Atas nama Gubernur DKI Jakarta mengucapkan selamat datang kepada semua delegasi Mayor Summit U20. On behalf of Governor of DKI Jakarta, we welcome all the delegates of Mayor Summit U20 and please welcome the Governor of DKI Jakarta, Mr. Rashid Baswedan. Selamat pagi, Assalamualaikum warahmatullahi wabarakatuh. Selamat datang. We are delighted to welcome you to the high-level talk show Road to Urban 20 Summit, Service Innovation in Gender-Based Violence Prevention and Response as part of Inclusive Social Recovery in DKI Jakarta. It is an honor for me, Tantri Murdopo, to serve as Master of Ceremony for this prestigious event. But first, please allow me to welcome our distinguished guest of honor, the Honorable, the Governor of DKI Jakarta as the host of Mayor Summit U20, Mr. Anies Rashid Baswedan. Selamat datang, Pak. Terima kasih banyak. The Ministers of Women's Empowerment and Child Protection, Mrs. I Gusti Ayu Bintang Darmawati, and about there, we are delighted to have Mr. Dr. Pribudiarta Nur Sitepu, the Ministry Secretary of Women's Empowerment and Child Protection, to present on her behalf. Selamat datang, Pak. Terima kasih banyak. The Officer in Charge of UNDP Indonesia, Mr. Nicholas Booth, welcome. And also our speakers for today, Dr. Widya Stuti MKM, Head of the Jakarta Health Provincial Department. Apa kabar Ibu? Selamat datang. Kemudian Dr. Ibal Singh Kelal, IAS Chief, Brihan Mumbai Municipal Corporation, Municipal Head Office, welcome. And also Senior Consultant, UNDP Seoul Policy Center, former Associate Director, Seoul Sunflower Center, Ms. Hee Young Park. And I would like also to welcome the Mayor Expert Discussion Delegate, the City Councilor of Quito, Mr. Juan Manuel Carrion Barragan, the Honorable Diplomatic Corps and Attaché from the Embassy of Canada, the European Union, the Embassy of Sweden, the IFI, representative from the United Nations Agency, and we would like also to welcome Ibu Sri Haryati as the Assistant to the Provincial Secretary for Economic and Finance, and also ladies and gentlemen, our distinguished guests for today. Starting the event, we would like to sing Indonesia's national anthem, Indonesia Raya. The audience kindly requested to stand. The audience are welcome to sit back. Ladies and gentlemen, our distinguished guests, to start the high-level talk show Road to Urban 20 Summit, I would like to invite to the stage the Governor of DKI Jakarta, Mr. Anies Rashid Baswedan. The stage is yours.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone, excellencies, distinguished speakers, distinguished participants, ladies and gentlemen. Allow me, on behalf of the city of Jakarta and of the organizing committee of U20, to welcome all of you in the U20 Summit. And we're delighted with the side event that is organized this morning on very important issue that is of interest to all of us. And I truly appreciate UNDP for organizing this event. I'd like to express my appreciation to Mr. Nicholas Booth for the organizing and for the support for U20 event, and particularly on this side event that addresses very important issues for all of us. Allow me to share a bit about Jakarta, and hoping that our experience may also be interest to the conversation and may also be helpful for the panel discussion that is organized this morning. Jakarta is a city with 11 million populations. So ensuring that we are able to provide equal facility, equal protection, and equal access to all services is needed. But talking about 11 millions and then translating that into simple approach is our challenge. We can have thick documents about how we go about it, but I translated that into a simple mantra, I would say. The message is this: if we are able to ensure protection, facility, equal access to 4 groups in our society, then we're home free. What are the 4 groups? 1 is the elderly. That's a critical group, ensuring them having protections. 2 is people with disabilities. 3, children, underage individuals. 4, women, and especially pregnant women in addressing facilities. And if we are able to put this 4 category in mind in every infrastructure development, in every programs we're undertaking, then we will be able to facilitate everyone. That's sort of the mantra. Now, there is extra attention needed. The fact that we are seeing incidents of violence, specifically gender-based violence, which is the subject of today's conversation. And on that subject, in Jakarta, we decided to translate this global concern into actionable program. We are in government, therefore we have one authority, two fiscal power. So that concern needs to be translated into programs and needs to be financed and needs to be executed at the field. So we in the government of Jakarta have a 5 years planning, and then we translate it into what we call Kegiatan Strategis Daerah, regional strategic programs. And it consists of more than 70 programs. The programs, one of them is prevention and countermeasures against violence of women and children. And it is called Strategic Program number 13. With that is being translated into activities that is being measured by the Office of the Governor, ensuring that every department that relates to the Strategic Plan number 13 is executing the plan. Making statements is easy. Allocating budget is easy. Making sure that the budget is allocated in the right way and executed in the right way, that's a different thing. That's called management. And so when we said this program is in the strategic regional project, it means every related department will have to support, and we will have monthly monitoring of the executions of that. And because of that, then there has been some innovations. Integrated service for protections of women and children. That's one of the innovations. This include complaint service as how we respond to cases, respond to complaint, and we're providing home visit, victim outreach. There is also a referral to safe house and hospitals, and reintegrations to the community. And there is a call center, 112, available 24 hours, and even WhatsApp support. And then another aspect is legal and psychological services that cover free consultations, mediation, legal assistance. Whenever there is case reported and the victims is in the police office, for example, we will be able to send one of our team to accompany to make sure that all legal procedures were being supported. And not only that, actually, whenever there is an abuse case, violence toward women, we do not differentiate whether the victim is resident of Jakarta or non-resident of Jakarta. If you're coming to our hospital, they will be treated at free of charge. If they come to our facility, they will be supported. Because when it comes to victims, it doesn't matter where they're officially registered as resident. So in our we use the term KTP. KTP is a ID card, and often government services is been based, regional services is been based on KTP. But when it comes to victim of violence, we disregard all of that. Just like when we are facing COVID, it doesn't matter where you stay. You come to our hospital, we treated you because of that. And that paradigm is with us. Why? Because we all need to see this as challenge to humanity. beyond programmatic approach. So with that, we hope that the paradigm, the strategic regional programs, and then the fiscal commitment that is made, we're making a difference in the executions at the operational level. And I can list a few of our action programs, but I will let the chief of the Jakarta Health Department to outline more of the details. But I'd like to share here is that I appreciate UNDP for bringing up this issue. We also understand the importance and the urgency, and we also understand that there's a lot of innovations that we still need to learn. We don't pretend to have invented and produced perfect programs. We are here to learn to adopt new approach. We can share our approach, but that doesn't mean it is the best and need no more improvement. No, we need to continue making innovations, making improvement along the way. And a session like this is very important for us so that we can have sessions of sharing best practices from across cities, from across institutions, and that how we can also improve our programs here. But the message I'm delivering today, this morning, is the message that Jakarta is committed. And Jakarta is converting that commitment into programs, into concrete fiscal commitment and resources commitment that we hope we will be able to provide comprehensive protection, and we hope to be able to create a feeling of safety. There is one other aspect that I'd like to share here, that given the fact that Jakarta is the center of Indonesia, this is the capital, but this is also the capital city, but this is also the center of the economy, the center of the culture, the center of mobility. It is basically the hub of Indonesia. So any innovation and any conversation that is taking place in this city is transferable to so many cities. And our city has experienced visitors from all over Indonesia coming in to do a mutual learning. They call it visit and study. And we do hope that from these sessions, so to all the panelists, all those who are participating, let's have that in mind, that this is not only benefiting all of us who are in the room, not only us who are doing our work in the city government in Jakarta, but also can be also beneficial to many outside our city. Again, thank you for organizing this event. I hope there will be a productive and mutual learning happening, and may the event goes well, and may all of us be able to learn from this important event. Thank you very much.
Terima kasih. Kami mohon Bapak Gubernur untuk tetap berada di atas panggung because we are going to have a photo sessions. Kami mohon Bapak untuk berada di tengah panggung. Kami mengundang foto sesi yang pertama untuk semua speaker, to all the speakers and panelists. For that we are going to invite Mr. Nicholas Booth, Dr. Pribudiarta, Dr. Widya Stuti, Dr. Iqbal Singh Kelal, Mr. Juan Manuel, and also Mr. Christian Asfinit, and also Ibu Sri Haryati, Assistant to the Provincial Secretary for Economic and Finance, for the first photo session. And for the next session, we are going to have the photo session with the Governor of DKI Jakarta and all the embassy representatives. And after this, we're going to invite all the diplomatic corps and attaché from the Embassy of Canada, the European Union, the Embassy of Sweden, the IVI or IV, and also the representative from the United Nations Agency after this photo session. Thank you for all the speaker and panelists. One more time. Bapak Gubernur, kami mohon untuk satu kali lagi ada foto sesi dengan para duta besar atau perwakilannya. Izin ya Pak Gub, satu lagi dengan para duta besar dan perwakilannya. We are invite the diplomatic corps and attaché from the Embassy of Canada, the European Union, the Embassy of Sweden, the IV representative from the United Nations Agency to come to the stage for the second photo session. Please. Terima kasih banyak. Thank you very much for the photo session. Thank you very much the government of DKI Jakarta for the beautiful remarks. And as the host of U20 in Jakarta, terima kasih banyak Pak Anies Baswedan. Kita berikan tepuk tangan untuk Gubernur DKI Jakarta. Please give a round of applause for Governor of DKI Jakarta, Bapak Anies Rashid Baswedan. Siap. Thank you very much. Mr. Governor just told me that he has to...
Excellencies, I'd like to excuse myself. I'll be visiting another side event session to welcome the session over there. So I wish you all the best for the conversation. Thank you.
Thank you very much. Berkenan meninggalkan tempat acara Gubernur DKI Jakarta, Bapak Anies Rashid Baswedan. The Governor of DKI Jakarta, Mr. Anies Rashid Baswedan. Bapak Ibu sekalian, ladies and gentlemen, our distinguished guests, we are going to start to the next agenda for this event. Thank you very much once again to Governor of DKI Jakarta, Mr. Anies Rashid Baswedan, as the host of U20. Thank you. Okay. Ladies and gentlemen, and now we are going to welcome Mr. Nicholas Booth, the officer in charge of UNDP Indonesia, for preface remarks. The stage is yours.
Selamat pagi, good morning everybody. It's really an honor for me to be here this morning for us to have had Bapak Anies, the Governor of Jakarta, with us, to be joined by Pak Prabudianto, to be joined by Juan Manuel, all the way from Quito, really on the other side of the world, from Dr. Iqbal from Mumbai. It really shows the importance of the U20 and this event, and I'm really excited about the sharing that we're going to have. It's a really important theme. So, you know, as much as we were all of us, devastated by the pandemic, and as much as the pandemic set back the road to the SDGs for all of us, women were affected much more severely. And on the one hand, it was women who were really at the front lines of the response to COVID. Women made up the majority of health workers around the globe. And yet, women were the ones who, you know, in informal economies, they were the ones who lost their jobs first. It was women's health that suffered most, women's opportunities that were most affected, and of course, as Bapak Anies just told us and reminded us, the impact on gender-based violence, which rose so much during the pandemic. Of course, women were the ones who suffered from that too. But the theme of today's event and this year's G20 is about recovery. It's a theme, as you know, it's recover together, recover stronger. And cities have a really important role in that. You know, cities throughout history have always been the place, you know, the genius of cities has been interconnection and innovation. They've always been the place where women and men, young people and old people of all different kinds from all places meet together, and where the genius of human creativity is really felt the most, and human connection and interconnection. And Bapak Anies told us about the innovations, you know, of Jakarta, and we will hear about the innovations in Quito and the innovations in Mumbai. You know, we know that Mumbai is perhaps the most densely populated city in the world. We were terrified when COVID-19 hit in an environment like that. How did Mumbai succeed in having one of the world's lowest mortality rates? You know, how did Quito manage to keep its population fed? How was food security secured? And how did food banks manage to survive in the darkest days of the pandemic? These were incredible challenges. Their cities and others rose to them. We have so much to learn from each other. And so in this G20, which is about solidarity, which is about recovering together to recover stronger, it's all about sharing our innovations, sharing our genius, sharing our solutions, recognizing we have a lot to share with other countries, but they have, and other cities, and they have a lot to share with us. And this is one of the places where that's going to happen. For us in UNDP, cities have always been critical partners because of their huge contribution to human development and their innovation and genius. And we're proud of our collaboration with Jakarta. We work very closely, especially on strengthening services to women who are survivors of gender-based violence, and we're going to hear more about that today. And we're proud of that. We're proud of our work with cities around the world. So I'm really excited to be here and really looking forward to our discussion. Thank you very much.
Thank you very much, Mr. Nicholas Booth. And next, ladies and gentlemen, our distinguished guests, we are about to see the remarks from the Minister of Women's Empowerment and Child Protection, Mrs. Igusti Ayu Bintang Darmawati, who has been recorded before.
Selamat pagi, salam sehat untuk kita semua. Bapak Ibu yang kami hormati, pada kesempatan ini, yang pertama, saya mohon maaf yang setulus-tulusnya kepada panitia penyelenggara tidak bisa hadir secara langsung di acara yang luar biasa ini. Untuk materi nanti akan ada yang mewakili. Yang kedua, kami menyampaikan apresiasi dan penghargaan yang setinggi-tingginya kepada UNDP, pemerintah daerah DKI Jakarta, demikian juga dukungan dari pemerintah Jepang dan juga dukungan dari USBC Korea dalam penyelenggaraan kegiatan hari ini. Kami di Kementerian Pemberdayaan Perempuan dan Perlindungan Anak untuk menjawab isu-isu pemberdayaan perempuan dan pemenuhan hak anak, kami mendapatkan 5 mandat, 5 isu prioritas yang harus kami selesaikan. Nah, tentunya dari 5 isu prioritas tersebut, salah satunya penurunan angka kekerasan terhadap perempuan dan anak ini masih menjadi PR yang harus kita selesaikan bersama. Maka pada kesempatan yang baik ini, kami mohon dukungan Bapak Ibu yang hadir pada forum ini untuk kita ajak bersinergi, berkolaborasi untuk menjawab isu-isu yang perlu kita selesaikan. Kami melihat wadah dari U20 atau Urban 20 akan menjadi penting. Kami ajak bermitra untuk menyelesaikan isu-isu ini. Sinergi, kolaborasi adalah merupakan kekuatan. Kami, Kementerian Pemberdayaan Perempuan dan Perlindungan Anak, baru saja kami menyelesaikan acara Ministerial Conference on Women Empowerment yang kita laksanakan di Bali. Nah, salah satu hasil daripada konferensi tersebut, sinergi juga menjadi penekanan penting yang harus kita lakukan lintas negara untuk menyelesaikan permasalahan perempuan, demikian juga permasalahan anak-anak. Sekali lagi kami mohon maaf, selamat Kami harapkan, tentunya kita berharap acara ini berjalan dengan sukses dan lancar, dan kami sekali lagi mohon maaf yang setulus-tulusnya tidak bisa hadir secara langsung. Dan di akhir kata, sukses penyelenggaraan acara ini, kami tunggu kerjasama dan sinergi kolaborasinya dengan kami Kementerian Pemberdayaan Perempuan dan Perlindungan Anak untuk mewujudkan perempuan berdaya, anak terlindungi, Indonesia maju. Selamat pagi.
Thank you very much. That the Minister of Women's Empowerment and Child Protection, Mrs. I Gusti Ayu Bintang Darmawati. And here to present on our behalf, we have here the Secretary or Ministry Secretary, Dr. Pribudiarto Nursitapu. So later we're going to listen from you, right, as the representative of Ibu Bintang. Thank you very much. So ladies and gentlemen, we are going to go to the next agenda, which is before we go into the talk show, we are going to see a snapshot, and this is a snapshot of a joint initiative between UNDP and DKI Jakarta Government on GVP prevention as part of inclusive COVID response and recovery.
Kekerasan berbasis gender telah menjadi pandemik bayangan yang mendesak untuk kita atasi. Pandemi COVID-19 menyebabkan kasus kekerasan meningkat 12%. Sejak 2011, pemerintah DKI Jakarta telah memiliki Peraturan Daerah Nomor 8 Tahun 2011 untuk perlindungan dari kekerasan terhadap wanita dan anak. Walaupun demikian, hingga 2022 lalu, kasus kekerasan berbasis gender, terutama wanita dan anak, tercatat mencapai 2.461 kasus. Sejak 2017, UNDP telah menjadikan DKI Jakarta sebagai daerah percontohan dalam meningkatkan akses terhadap layanan penting bagi korban kekerasan berbasis gender. Sebagai bagian dari respon terhadap COVID-19, UNDP memperkuat standar prosedur operasional di P2TP2A, Rumah Sakit Umum, dan unit PPA. Dan membentuk Pos Sahabat Wanita dan Anak POSAPA di berbagai universitas dalam mendukung program kota yang aman dan berkelanjutan yang hanya dapat terjadi dengan dukungan budget tambahan dari Jepang atau JSB. Untuk mempromosikan South-South Triangular Cooperation, UNDP bekerja sama dengan UNDP Sentral Kebijakan Seoul untuk transfer pengetahuan melalui aktivitas pembentukan kapasitas dalam meningkatkan layanan bagi korban kekerasan berbasis gender. Hal ini telah menghasilkan komitmen tingkat tinggi melalui penandatanganan nota kesepahaman antara pemerintah Provinsi Jakarta dan Kepolisian Metropolitan Jakarta untuk meningkatkan koordinasi bagi pelayanan bagi korban-korban kekerasan berbasis gender. Bekerja sama dengan pemerintah Provinsi DKI Jakarta, kami memperkuat sentral layanan terintegrasi berbasis rumah sakit bagi penyintas kekerasan berbasis gender di Indonesia sebagai bagian dari respon inklusif sosial dari COVID-19. Percontohan dari Sunflower Center, PPT Bunga Tanjung memberikan semua pelayanan penting dalam satu atap dan diberi penghargaan sebagai salah satu dari 45 layanan publik terbaik di negara ini di 2021. Inisiatif ini sebagai komitmen berbagai pemangku kepentingan dalam menangani kekerasan berbasis gender di provinsi ini sejalan dengan prinsip kesetaraan dan keadilan bagi seluruh masyarakat. Keseluruhan layanan termasuk dukungan medis dan hukum serta dukungan psikologi dan konseling oleh para spesialis memastikan semua layanan mencakup kebutuhan yang berbeda bagi para korban termasuk wanita, anak-anak, dan orang-orang difabel. Tersedia juga fasilitas yang aman dan dapat diakses oleh anak-anak dan penyandang difabel, serta penilaian medis komprehensif dan layanan bagi para korban dengan kasus penting. Untuk mendukung program Kota Aman dan Berkelanjutan dan pemulihan inklusif setelah COVID-19, kami mengubah model layanan satu pintu kami menjadi satu area seluas 40 kaki untuk menggapai kelompok rentan dan mengatasi batasan ruang dan geografis. Sebuah kecantikan dengan kapasitas luar biasa, terobosan inovasi ini didesain dan direkayasa menjadi inklusif, mandiri dan swasembada yang juga terintegrasi dengan rumah sakit pusat.
Sehingga kami sangat mengapresiasi kolaborasi inklusif bersama UNDP Indonesia yang telah terbina sangat erat selama ini, khususnya terkait perlindungan terhadap perempuan dan anak tersebut. Bentuk kolaborasi ini kami wujudkan dengan adanya Pusat Pelayanan Terpadu Bunga Tanjung di RSUD Tarakan.
Untuk seluruh perempuan di luar sana, jangan takut untuk mencari bantuan. Bersama kita bisa melawan kekerasan melalui aksi kolektif kita. Bersama kita bisa.
Let's give a round of applause for this joint initiative between UNDP and DKI Jakarta Government on GBV prevention. Ladies and gentlemen, it is time for us to be in the talk show session, and for that, I would like to invite all the speakers and panelists to be on the stage. So please welcome Mr. Nicholas Bud, Mr. Pribudiarta Nursitepu, Ibu Widya Stuti, Mr. Iqbal Singkehal, and also Mr. Juan Manuel Carion Baragan. So we are going to start with the first speaker, which is Mr. Nicholas Bud, and I'm going to introduce all of you for the first speaker. Mr. Nicholas Bud is currently serving as officer in charge of UNDP Indonesia, and he is governance and peace-building team leader at the UNDP Bangkok Regional Hub, covering Asia and the Pacific, and has been based in the regional hub since 2013. Taking up his responsibilities as team leader in 2020 after 7 years as the lead regional advisor on conflict prevention, access to justice and human rights. Before joining the UN in 2001, he worked for 12 years as a lawyer in the UK and the US, specializing in labor rights and discrimination, and was an active pro bono lawyer. And he studied law at Brasenose College, Oxford, and also Queen's College, Cambridge, and was visiting lecturer and researcher in comparative law at the Institute in Pantheon, Sorbonne. So I'm going to start with you, Mr. Nicholas Bud, with 3 questions. And we only have about 13 minutes, so a very limited time with a very insightful answer. I hope that.
Okay.
So,
no pressure there.
no pressure at all. Let's start, Mr. Nicholas Bud. The first questions for you. Why is, Mr. Bud, the protection of women and children essential to attaining the SDGs and also 2030 agenda, particularly during and post-pandemic?
Okay, well that's easy.
So shorter than 3 minutes then.
Shorter than 3 minutes for sure. You know, we can't achieve the SDGs unless we achieve them for everybody, and that includes women. So the sustainable future is a gender-equal future. But we're very far from that. We had a huge gender gap, and this is globally, and it's true of Indonesia, but it's true of everywhere else in the world. We had a big gender gap in access to employment, and access to healthcare, in so many things, even before the pandemic, and it got worse. But gender-based violence was one of the worst ways in which the pandemic made human security worse for women. And so the need to increase the services to survivors of gender-based violence and then strengthen the protection of women is even stronger after the pandemic than it was before.
So which is, it is good in a way, or is it bad in a way? How do you see that?
Sorry?
So is it good in a way, or is it bad in a way after the post-pandemic?
Well, look, we just have to work more strongly and more innovatively. We need to catch up the gap. We need to ensure that women are as well protected from violence as men. But that's always going to be, given that gender-based violence, it was already a huge problem before the pandemic. 1 in every 3 women globally has experienced physical or emotional violence at the hands, often of their intimate partners. And, unless we are able to eliminate the pandemic of violence, of gender-based violence, we haven't actually got over this pandemic.
Okay, so let me enhance that to the city role. Okay, so the next questions will be, why is sustainability and inclusive city integral to the realization of the Sustainable Development Goals? And actually, Mr. Booth, what is the role that a city government can play to support the agenda of 2030 during and post-COVID-19?
Well, cities have always been critical to human civilizations, but they become more critical all the time. We are living in a rapidly urbanizing world. So actually, by 2050, 70% of the world's population will live in cities. So if we can't achieve human development there, we're failing 70% of the world's population. We really need to focus in cities. And at the same time, and I'm sure we're going to hear this because we've got great representatives from Mumbai and Quito here, cities are also, as I said earlier, they are also extraordinary places of innovation. So while they face incredible challenges, they are also the places where great solutions are found and where the innovations happen. So they really will be, they'll be critical in terms not only of the challenges, but also the solutions as we go forward.
Okay, so since you already mentioned about Mumbai and also Quito, let me ask about DKI Jakarta, okay? Because we are here and the DKI Jakarta also the host of U20 Indonesia. So what are the main considerations, Mr. Booth, for collaborating with DKI Jakarta, a provincial government, is actually to implement this joint initiative on GBV prevention and eradication as part of COVID-19 response and recovery, of course?
So again, I think both the points I just made are just as true for Jakarta. So on the one hand, Jakarta, as as a mega city, faces and continues to face really strong challenges from gender-based violence. And just as the pandemic exacerbates gender-based violence everywhere in the world, it got much worse across Indonesia. There was a 12% increase, as we just heard from that video, and that was true in Jakarta too. So on the one hand, Jakarta is a place where we need urgently to focus if we are to have an effective response and protection for women in Indonesia. But at the same time, Jakarta has always been a great partner for us. Jakarta city government has always put a high priority on, as we heard from the governor, on ensuring services to everybody and prioritizing, as he said, women as well as children and elderly people and people with disabilities, and measuring themselves by, as he said, unless we actually provide adequate, good, equal services to those groups, we're not doing our job. So we are very much aligned, UNDP and the Jakarta city government. We've had a very strong partnership for 5 years now, and strengthening gender-based violence services has been part of that. And on the one hand, there's a good enabling environment. The city government has very strong policies, regulations in place, but we need to back that up with services. And there, we've been very lucky with our support from Korea. So, we were able to bring the experience of the Korea Sunflower Center to inspire the gender-based violence service centers that we have here. And our one-stop service center is really now moving to the next stage of an interdependent, inclusive and integrated module. So we are really using innovations from around the world and bringing them to Jakarta, because this is really a partnership that is putting those best ideas from other places into place.
Yeah, and we are hoping for another initiative, a lot more initiative for UNDP and also DKI Jakarta. Thank you very much, ladies and gentlemen, Mr. Nicholas Booth, for highlighting the importance of GBV prevention to achieve SDGs and also the agenda of 2030, and also the initiative of UNDP and DKI Jakarta government. Thank you very much. And next, we are going to meet the second speakers, which is the representative of Minister of Women's Empowerment and Child Protection. So we take away that the challenge of translating inclusive COVID-19's economic and social recoveries plan into sustainable household resilience that cannot be addressed without ensuring protection from gender-based violence for half of Indonesia's population, and women as key economic and social actors. And with this background, the U20 can play a pivotal role in gaining further attention and commitment to increasing protection for women, children, and other vulnerable groups from the threats of gender-based violence by the international community. And that's why we're going to hear we are going to hear from the Secretary Minister of Women's Empowerment and Child Protection, Mr. Dr. Pribudiarta Nur Sitepu.
Thank you. Would I speak in Indonesia, bahasa?
Bahasa juga boleh, Pak, jikalau dirasa nyaman. Silahkan.
Okay. Terima kasih. Jadi Kementerian Pemberdayaan Perempuan dan Perlindungan Anak, yang pertama-tama kami punya survei nasional yang mendasari dari kondisi aktual kekerasan terhadap perempuan dan kekerasan terhadap anak di Indonesia. Pertama kami mulai dari data dulu untuk menggambarkan bagaimana kondisi real yang ada di kondisi real dari gunung es kekerasan. Yang pertama kami punya survei pengalaman hidup perempuan nasional tahun 2021 yang lalu, di mana datanya menunjukkan 1 dari 4 perempuan pernah mengalami kekerasan fisik, seksual oleh pasangan atau selain pasangan. Kemudian kami juga punya survei nasional yang disusun bersama dengan BPS mengenai pengalaman hidup anak dan remaja. Kita mengetahui bahwa 4 dari 10 remaja perempuan dan 3 dari 10 remaja laki-laki usia 13 sampai 17 tahun pernah mengalami kekerasan, baik secara fisik, psikis, seksual, ataupun bentuk-bentuk lain sepanjang hidupnya. Jadi jumlahnya cukup besar populasi yang mengalami kekerasan. Nah, kalau kemudian kita lihat bagaimana kondisinya selama pandemi COVID, kami menyampaikan tadi data nasional tahun 2021. Berarti bagaimana kondisi pandemi COVID paling tidak selama 12 bulan terakhir di tahun 2020 dan 2021, angkanya menunjukkan terjadi kenaikan yang cukup signifikan karena akibat pandemi COVID. Nah, terus kemudian kalau kami melihat bagaimana kemauan untuk berbicara, dare to speak, dari korban, nah, kami punya namanya hotline Sapa 129. Nah, dari hotline Sapa 129 ini kami menerima laporan dari 34 provinsi dan 215. Jadi baru 215 dari 514 kabupaten kota. Dan data juga menunjukkan bahwa dalam 12 bulan terakhir terjadi kenaikan yang cukup signifikan. Walaupun secara jangka panjang, jadi dalam 5 tahun, memang terjadi penurunan yang cukup signifikan. Terjadi penurunan yang signifikan dari kasus kekerasan, tapi dalam 12 bulan terakhir terjadi peningkatan karena akibat dari pandemi COVID. Jadi kami melihat bahwa itu kondisinya. Nah, kemudian hal yang merupakan milestone penting saya pikir terkait dengan penanganan kekerasan ini adalah dengan disahkannya Undang-Undang 12 tahun 2022, baru beberapa bulan yang lalu. Nah, di dalam undang-undang tersebut terdapat 10 kementerian lembaga yang menjadi penanggung jawab utama dari layanan terpadu itu tadi. Nah, 10 kementerian lembaga itu kemudian tentunya harus dipastikan karena ini era desentralisasi bahwa pemerintah daerah, provinsi dan kabupaten kota juga diharapkan inline dengan polisinya yang ada di tingkat nasional. Di mana dalam polisi di tingkat nasional 10 kementerian lembaga itu harus memberikan layanan one stop services terhadap korban kekerasan. Nah, karena itulah ke depan kami juga mengubah protokol-protokol layanan tersebut yang semula terdiri dari 6 jenis layanan, kemudian dikembangkan menjadi 11 jenis layanan yang tentunya harus dilakukan secara one stop services. Yang sebelumnya layanan-layanan itu kan dilakukan secara terpisah-pisah, di mana korban kemudian mendatangi unit layanan. Nah, ke depan kita mengharapkan bahwa korban tidak perlu berpindah-pindah tempat, tapi unit layanannya yang akan mendatangi korban tersebut. Dan kemudian korban ditangani secara holistik, integratif, mulai dari rehabilitasi kesehatan, rehabilitasi sosial, sampai dengan proses penegakan hukum. Nah, itu kita harapkan kemudian korban mendapatkan layanan yang komplit tersebut. Jadi mungkin itu yang menjadi gambaran. Tantangan terbesar kami adalah mendorong agar perempuan dan anak berani untuk bicara. Karena kami melihat masih ada kesenjangan yang cukup lebar antara data prevalensinya yang tadi menunjukkan ada puluhan juta sebenarnya korban, dengan perempuan dan anak yang berani melapor, yang jumlahnya hanya berkisar sekitar 6.000, 8.000 setahun. Itu mungkin gambaran kekerasan.
Oke, satu pertanyaan singkat Pak, bagaimana cara mendorong agar ibu dan anak ini kemudian mau speak up? Seperti yang tadi Bapak katakan bahwa itu adalah tantangannya. Berarti sekarang apa yang dilakukan?
Tugas untuk menangani kekerasan, selain itu tadi 10 kementerian, lembaga, dan seluruh jajarannya sampai di tingkat pemerintah daerah, tapi juga menjadi tanggung jawab dari seluruh komponen masyarakat, lembaga masyarakat, seperti tokoh agama, tokoh adat, tokoh masyarakat, bahkan pada unit-unit yang paling kecil sampai di tingkat desa, mereka harus meningkatkan awareness, sensitivitas dari seluruh komponen masyarakat, agar mereka kemudian sensitif terhadap isu-isu perempuan dan isu-isu anak.
Baik, terima kasih banyak Secretary Ministry of Women's Empowerment and Child Protection, Bapak Pribudiarta Nursitepu. Thank you very much. The highlight about protection of victims of violence against women and children during and post-pandemic COVID-19. Thank you very much. And next, we are going to have the presentation. So it's a presentation of Dr. Widya Stuti MKM. Beliau adalah Kepala Dinas Kesehatan DKI Jakarta, di mana presentasinya adalah mengenai Service Innovation in GBV Prevention and Response as part of Inclusive Social Recovery in DKI Jakarta. Sedikit saya ceritakan mengenai Dr. Widya Stuti ini. So she's a doctor with 30 years of experience in primary healthcare and public health services, including the surveillance and management of communicable and non-communicable disease and health promotion. She's an expert in health policy development and implementation, and currently the head of Jakarta Provincial Department of Health, and she has a wide range of professional medical skills while promoting good governance, and she is still active in writing scientific papers and is a member of several medical and non-medical organizations. So please welcome Dr. Widya Stuti. Silakan Ibu.
Selamat pagi, saya izin memaparkan dalam bahasa Indonesia bagaimana pengalaman DKI Jakarta melakukan inovasi layanan kekerasan pada perempuan dan anak atau kekerasan berbasis gender, yang tentunya kami juga masih butuh penguatan, tambahan saran dari para audiens kali ini. Ya, next slide. Jakarta adalah suatu kota, ibu kota negara dengan jumlah penduduk 11 juta lebih, di mana laki-laki dan perempuan mempunyai proporsi yang hampir sama. Kemudian keunikan Jakarta adalah terdiri dari 5 kota dan 1 kepulauan Jadi tidak hanya daratan, tapi kami juga mempunyai wilayah yang berbasis lautan. Ya, next slide. Jumlah penduduk DKI Jakarta yang 11 juta tadi, mayoritas adalah di usia produktif di usia 30 sampai 40 tahun. Kami ingin menggambarkan bagaimana gambaran kejadian kekerasan pada perempuan dan anak di Indonesia maupun di Jakarta. Menyitir data dari Kementerian PPA menunjukkan angka kekerasan pada perempuan atau berbasis gender itu terjadi peningkatan yang luar biasa. Grafik menunjukkan sejak tahun 2016 sampai dengan tahun sekarang. Sengaja untuk tahun 2022 itu kami gambarkan dalam garis putus-putus karena menunjukkan angkanya belum selesai. Indonesia dan Jakarta menunjukkan tren yang sama. Keduanya secara nasional peningkatan dan di DKI peningkatan. Secara gender, kejadian pada perempuan lebih tinggi dibandingkan pada laki-laki, tetapi tidak menutup kemungkinan bahwa kekerasan juga terjadi pada laki-laki. Ya, next slide. Data ini juga kami ambil dari Kementerian PPA bahwa angka kejadian kekerasan pada perempuan mayoritas di usia kelompok 25 sampai 40 tahun, sedangkan pada anak-anak terjadi sebagian besar di usia sekolah menengah pertama maupun sekolah menengah atas, yaitu di usia 13 sampai 17. Tentu data ini sangat penting nanti dalam rangka intervensi ke depan untuk mengendalikan angka-angka tersebut di sesuai kelompok usia terbanyak. Indonesia dan Jakarta menunjukkan angka yang sama. Apa jenis kekerasan terbanyak? Ternyata baik di tingkat pusat maupun di tingkat DKI Jakarta, terbanyak adalah kekerasan seksual, baik di tingkat pusat maupun di tingkat DKI Jakarta. Ya, next slide. Selanjutnya kami mencoba menggambarkan kekerasan pada anak-anak, terutama baik itu di Indonesia maupun di Jakarta, sebagian besar adalah pada anak perempuan. Ya, next slide. Bapak Ibu sekalian, para hadirin yang berbahagia, kami ingin menyampaikan bahwa tadi seperti yang disampaikan oleh Bapak Gubernur, DKI Jakarta sudah mempunyai regulasi yang kuat. Jadi komitmen pemerintah DKI Jakarta terhadap masalah kekerasan berbasis gender itu sudah terwujud, terimplementasi sejak tahun 2011. Kami mempunyai suatu peraturan daerah regulasi yang mengatur bagaimana perlindungan kekerasan pada perempuan dan anak. Tentu peraturan ini terus-menerus kami kembangkan, disesuaikan dengan kondisi kekinian termasuk pada masa pandemi, dan tentu sesuai dengan semangat Jakarta sebagai kota kolaborasi, tidak mungkin kami bekerja sendiri. Kolaborasi pentahelik tentu sangat kita kedepankan sehingga penanganan kekerasan pada perempuan dan anak itu akan bisa tertangani. Salah satu turunan kebijakan adalah tadi seperti yang disampaikan oleh Bapak Gubernur, bahwa kegiatan ini masuk dalam kegiatan strategis daerah, di mana bukan hanya saya memang berdiri dari Dinas Kesehatan, tetapi penanganan kasusnya sesuai dengan komitmen pemerintah DKI melibatkan semua unsur pemerintahan di DKI, apakah itu Dinas PPAPP, dinas yang mengingkupi tentang pemberdayaan perempuan dan anak, termasuk dinas pendidikan, dinas sosial, kepolisian, dan berbagai dinas lain, sehingga secara komprehensif nanti bisa berjalan dengan baik. Kami juga telah berkomitmen mengeluarkan suatu peraturan gubernur dan dilanjutkan dengan peraturan Dinas Kesehatan menunjuk 8 rumah sakit untuk siap memberikan layanan kekerasan pada perempuan. Di antaranya adalah Rumah Sakit Tarakan. Selain itu, sebagai bentuk komitmen, selain menunjuk vaskesnya, kami juga telah mengeluarkan regulasi masalah pembiayaan. Tadi Bapak Gubernur telah menyampaikan bahwa negara hadir untuk memberikan rasa aman perlindungan pada kekerasan berbasis gender ini melalui pembiayaan karena skema pembiayaan asuransi nasional belum mengcover pembiayaan kekerasan berbasis gender, belum mengcover pembiayaan kekerasan pada perempuan dan anak. Sehingga kami mengeluarkan Pergub tahun 2022 yang mengatur bahwa semua korban kekerasan berbasis gender mendapatkan layanan secara gratis. Ya, next slide. Bapak Ibu sekalian, tadi seperti saya sampaikan bahwa integrasi ini meliputi berbagai aspek, mulai dari psikososial, bantuan hukum, fasilitas layanan kesehatan, termasuk nanti bagaimana mekanisme kembali bersosialisasi, berinteraksi ke rumah maupun ke komunitas awal. Ya, next slide. Tadi sesuai dengan regulasi tentang pembiayaan kami laporkan, meskipun kami saat ini mempunyai 32 rumah sakit milik Pemprov DKI, tetapi dalam skema pembiayaan kami juga melibatkan rumah sakit vertikal maupun rumah sakit swasta. Sehingga para korban kekerasan pada perempuan dan anak atau berbasis gender ini bisa mendapatkan layanan apapun di semua rumah sakit yang ada di DKI Jakarta maupun di semua puskesmas. Puskesmas adalah suatu layanan setara di tingkat subdistrik, subdistrik, di tingkat layanan pertama itu juga bisa memberikan. Tentu level layanannya berbeda-beda antara step-step tersebut. Dan sebagai informasi, klaim tentang perawatan ini terus-menerus angkanya menunjukkan peningkatan. Ya, next slide. Nah, selanjutnya kami ingin bercerita bagaimana Pemprov DKI Jakarta mengembangkan Bunga Tanjung. Ya, next slide. Tadi saya sampaikan bahwa angka kasus kekerasan pada perempuan dan anak, angkanya menunjukkan terus-menerus meningkat luar biasa. Kemudian yang berikutnya adalah penanganan yang kita lakukan saat lalu itu belum secara komprehensif dan belum terintegrasi. Sementara kita tahu bahwa para korban kekerasan ini membutuhkan rasa aman dan nyaman yang selesai dalam satu layanan terpadu. Sehingga itu menjadi salah satu pemicu untuk melahirkan suatu layanan yang komprehensif tadi. Yang berikutnya adalah bagaimana Bunga Tanjung terintegrasi dengan berbagai layanan. Harapannya adalah klien selesai dalam satu atap tanpa berpindah-pindah. Ini sejalan dengan kebijakan Kementerian PPA, Kementerian Pemberdayaan Perempuan dan Anak, kalau tidak salah ada undang-undang tahun 2022, tetapi 2012 ya. Undang-undang 12 tahun 2022. Alhamdulillah DKI sudah lebih dulu hadir. Jadi kami mensupport sekali apa yang menjadi kebijakan pusat. Kita sudah mulai sejak tahun 2019 melalui Bunga Tanjung. Ya, selanjutnya. Ya, next slide. Ya, ini adalah skema Bunga Tanjung. Kami sedikit melakukan modifikasi. Tentu Bunga Tanjung bisa hadir karena komitmen yang kuat dari Direktur Rumah Sakit Tarakan sebagai pemangku kepentingan dengan didukung oleh sumber daya yang luar biasa. Tanpa kebijakan, tanpa komitmen dari top manajemen di tingkat layanan dan para pelaku, dokter maupun para pemangku yang lain tentunya tidak bisa berjalan dengan baik. Kami menyesuaikan pada era pandemi COVID karena angkanya menunjukkan peningkatan, tentu SOP-nya, standar operasional prosedurnya, itu kita harus sesuaikan. Kita pilih apakah klien itu COVID atau tidak COVID. Kembali sebelumnya, bahwa semua kasus layanan ini masuk ke rumah sakit atau masuk ke klinik Bunga Tanjung melalui berbagai kanal. Ada yang memang korban datang langsung ke klinik Bunga Tanjung di RSUD, ada yang karena rujukan dari kepolisian, ada yang rujukan dari P2 TP2A, ada yang rujukan dari social worker, atau dari puskesmas maupun rumah sakit yang lain. Jadi banyak kanal, banyak saluran, sehingga para korban bisa mengakses layanan tersebut. selain kami memilah apakah ini COVID atau tidak COVID, kemudian kita pilih tingkat kegawat daruratannya atau tingkat keparahan suatu dampak dari kekerasan. Kemudian tim dari Bunga Tanjung di RSUD Tarakan akan memasukkan sesuai hasil assessment. Apakah ini critical atau non-critical? Apakah COVID ataukah tidak COVID? Dan tentu layanan akan terus berlanjut sampai dengan kita terintegrasi dengan layanan paskanya. Setelah kasus kesehatannya teratasi, selanjutnya adalah apakah korban selesai atau harus butuh bantuan hukum. Itu tentu kita bergerak kepada bantuan hukum selanjutnya. Atau harus dilakukan tanda kutip semacam penempatan sementara di rumah-rumah sehat atau rumah aman yang diindikasikan atau dibangun oleh dinas sosial. Atau bisa langsung kembali kepada masyarakat bersama dengan keluarga. Jadi sekali lagi Bunga Tanjung ini hadir menjawab atas tantangan akan kebutuhan rasa aman bagi masyarakat. Ya, next slide. Bapak Ibu sekalian, tadi sudah dilihatkan di video bagaimana klinik Bunga Tanjung. Kami sampaikan bahwa klinik Bunga Tanjung ini merupakan suatu modifikasi atau inovasi oleh tim RSUD Tarakan di bawah koordinasi Direktur Rumah Sakit. Belum ada pedoman secara khusus di tingkat nasional bagaimana suatu klinik integrasi komprehensif ini dibangun. Sehingga dilakukanlah suatu inovasi dengan mengadop berbagai hal. Salah satunya adalah melalui kunjungan ke klinik di Korea, di Sunflower, yang atas inisiasi bersama dengan UNDP. Teman-teman melakukan modifikasi karena tentu masing-masing negara, masing-masing kota mempunyai kebutuhan yang berbeda. Kami mempunyai kearifan lokal yang tentu harus kami sesuaikan sehingga nanti utilisasi dari klinik tersebut bisa termanfaatkan dengan optimal. Kami laporkan, kami sampaikan bahwa keunikan ini adalah pertama, kenapa DKI memilih rumah sakit sebagai evidence base, sebagai dasar untuk layanan kekerasan. Karena kami melihat bahwa rumah sakit adalah tempat yang netral. Rumah sakit adalah tempat yang independensinya terjaga. Rumah sakit mendapatkan trust oleh masyarakat karena warga yang butuh dampingan itu akan lebih leluasa menyampaikan rasa masalahnya kepada teman-teman di rumah sakit. Di rumah sakit tentunya bukan hanya bertemu dengan dokter, kami juga siapkan psikolog, psikiater, dan dampingan sosial dari teman-teman dari TP2A maupun dari pemangku kepentingan yang lain. Bapak Ibu sekalian, yang unik lagi adalah bahwa kami tahu bahwa para korban tentu mempunyai masalah keterbatasan komunikasi. Apabila seorang korban ditanya berkali-kali, harus ke klinik A, klinik B, kemudian harus ke dinas kesehatan, ke dinas sosial, dinas PPAPP, ke kepolisian, pasti itu akan melelahkan dan membuat trauma-trauma baru karena selalu diingatkan. Sehingga kami hadirkan bahwa wawancara anamnese terhadap korban itu hanya sekali, satu pintu, dan itu sudah direkam melalui CCTV dan semua penanya itu bisa memantau dan menitipkan pertanyaan kepada satu orang sehingga seorang korban cukup bercerita, cukup menyampaikan segala rasanya satu kali dan itu akan terinput masukan kepada semua yang berkepentingan untuk menetapkan nanti assessment-nya seperti apa. Bapak Ibu sekalian, Bunga Tanjung sudah memodifikasi klinik sedemikian rupa sehingga klien kami mempunyai rasa aman dan nyaman untuk menyampaikan semua harapannya. Sekali lagi, tentu ini terjadi bukan karena kesehatan saja, tapi integrasi dari berbagai pihak. Ya, next slide. ini adalah gambaran bagaimana pergerakan progres kasus yang tertangani. Memang belum semuanya terekam dalam angka di Bunga Tanjung. Masih ada angka-angka yang berobat selesai di layanan yang lain. Tetapi melalui inovasi Bunga Tanjung yang satu atap, terjadi progres yang signifikan. Yang semula angkanya adalah kecil, di angka sekitar di bawah 10, saat ini lebih dari 150 yang mengakses layanan kami. Ini menunjukkan bahwa kepercayaan klien, kepercayaan mitra kita untuk memanfaatkan layanan kita semakin meningkat. Dan harapan kita tentunya ini menjadikan solusi untuk memberikan tadi rasa aman dan penyelesaian masalah kekerasan berbasis gender. Ya, next slide. Kami ingin menginformasikan bahwa sebelum dan setelah, tadi selain peningkatan rasa percaya trustnya lintas sektor kami terhadap layanan kami, juga kita membuat semacam indikator standar pelayanan minimal, sehingga integrasi berbagai multidisiplin ilmu terjaga. Kita sengaja memilih Tarakan karena rumah sakit kami Tarakan ini mempunyai multidisiplin ilmu kesehatan dan non-kesehatan yang bisa kita ajak. Sehingga klien tidak perlu berpindah tempat, cukup selesai di dalam klinik dan para disiplin multidisiplin ilmu kedokteran yang hadir ke situ untuk memberikan layanan. Sehingga korban tentunya lebih nyaman. Kemudian juga visum. Yang sebelumnya visum itu lama, hampir lebih 1 bulan. Karena terintegrasi sehingga hasil visum yang dibutuhkan. Visum ini meliputi visum yang bersifat fisikal atau visum psikiatrikum yang sangat dibutuhkan untuk kelengkapan data apabila dibutuhkan untuk proses legal atau proses hukum. Dan itu bisa dipercepat. Yang sebelumnya lebih 1 bulan, saat ini kita bisa mengeluarkan visum kurang dari 2 hari. Tentu ini sangat bermanfaat karena kita tahu bahwa dampak jejas kekerasan pada korban kadang-kadang bisa berubah oleh karena waktu. Sehingga kecepatan memeriksa, kecepatan mengeluarkan hasil menjadi sangat penting. Ya, next slide. Bapak Ibu sekalian, Jakarta sebagai kota kolaborasi, sekali lagi kami sampaikan pentahelik menjadi suatu poin penting untuk menyelesaikan kasus ini. Kami penguatan terhadap pengembangan layanan, penguatan terhadap integrasi yang terus-menerus kita lakukan, dan juga campaign supaya tidak terjadi masalah di kemudian hari. Campaign terhadap pencegahan, kita bermitra dengan berbagai pihak. Tadi disampaikan oleh Bapak Gubernur dan di dalam slide bahwa atas dukungan para NGO, teman-teman dari PPA bisa menggandeng berbagai universitas di DKI. Dan kami juga akan berkolaborasi dengan Dinas Pendidikan. Karena tadi angka kita menunjukkan bahwa sebagian besar di rentang usia anak adalah di usia 13 sampai dengan 17 tahun. Tentu kami harus masuk di institusi pendidikan. Ya, next slide. Di sini kami memberikan apresiasi dan penghargaan yang setinggi-tingginya terhadap UNDP yang telah bermitra dengan Pemprov DKI sejak awal. Jadi hadirnya UNDP sebagai mitra kami mengakselerasi terwujudnya integrasi layanan secara komprehensif tadi. Tadi saya sampaikan bahwa memang DKI sudah ada, tetapi dengan hadirnya dampingan dari UNDP, percepatan terwujudnya integrasi secara komprehensif multidisiplin ilmu kedokteran internal di Rumah Sakit Tarakan, internal di Dinkes yang melibatkan berbagai vaskes kami, termasuk transportasi, dan integrasi terhadap lintas sektor, bukan hanya kesehatan, sosial, PPAPP, Dinas Pendidikan, Dinas Tenaga Kerja, dan Polda menjadi unsur yang sangat penting. Sekali lagi kami memberikan apresiasi terhadap UNDP yang terus-menerus menjadi mitra yang sejak tahun 2018. Ke depan tentunya kami tidak berhenti di sini. Meskipun ini sudah ada, tetapi tentunya kami belum puas karena dari angka yang ada belum semua korban mengakses layanan Bunga Tanjung. Perlu banyak dilakukan terobosan, berbagai edukasi, sosialisasi maupun strategi pemasaran yang lain, termasuk apakah memang perlu dikembangkan mereplikasi layanan serupa di kota yang lain. Tentu data dasar mapping kami, baik itu data dari Kementerian Pusat maupun dari DKI sendiri untuk memetakan di kota mana nanti yang paling membutuhkan sehingga nanti bisa kita replikasi. Uniknya DKI atau uniknya Bunga Tanjung sekali lagi berbasis layanan kesehatan sehingga independensinya, integrasinya bisa lebih terjaga. Ya, next slide. Ini adalah berbagai penghargaan yang didapatkan oleh Pemprov DKI Jakarta, baik yang diterima oleh Dinas PPAPP dari tingkat pusat, terima kasih Pak Sekjen, maupun kami tadi seperti disampaikan Bapak Gubernur, alhamdulillah atas inovasi Bunga Tanjung dengan kolaborasi Pentahlik dan dukungan dari UNDP, tahun 2020 Bunga Tanjung mendapatkan penghargaan apresiasi nasional 45 top layanan publik terbaik sebagai inovasi yang harapannya bisa menginisiasi inovasi dan direplikasi di provinsi ataupun di kota-kota lain di luar DKI Jakarta. Ya, next slide. Ya, demikian paparan saya. Tentu kami masih jauh dari sempurna. Masukan, bahasan, dukungan dari Bapak Ibu sekalian, kami harapkan demi kebaikan optimalisasi layanan kami. Terima kasih. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Terima kasih Dr. Widya Stuti. Terima kasih banyak for the insightful presentation. Bunga Tanjung nama yang sangat indah, semoga bisa menghasilkan keindahan juga untuk perempuan dan anak-anak di DKI Jakarta. So ladies and gentlemen, now it's time for us to fly a little bit to Mumbai. Because Mumbai has some best practice in GBV prevention during and post-pandemic. And to learn from the success story, we are now continuing the agenda that is the presentation which will be delivered by Dr. Iqbal Singh Kelal. I as Chief Briha Mumbai Municipal Corporation, Municipal Head Office. And I'm going to read a short bio about Dr. Iqbal. He received a honorary Doctor of Science from Thapar Institute of Engineering and Technology in November 2021. And currently, he is the Municipal Commissioner and Administrator of Briha Mumbai Municipal Corporation, and also served the government of Maharashtra and India in various capacity. So Dr. Iqbal, the time is yours.
Could you please put the presentation? Distinguished ladies and gentlemen, I am grateful to the organizers for providing me this opportunity today to present gender-based violence issues in Mumbai in general, India in particular, and overall all over the world. You know, the United Nations General Assembly has defined gender-based violence as an act of that results in or is likely to result in physical, sexual, psychological harm or suffering for women, including threats of such acts, coercion or arbitrary deprivations of liberty, whether occurring in public or private life. It also refers to harmful acts directed at individual based on their gender. And basically it is rooted in gender inequality, the abuse of power, and harmful norms. It is estimated that 1 in 3 women experience sexual or physical violence in their lifetime, which is huge. And during displacement and times of crisis, the threat of GBP increases manifold in women and girls. Why GBP? Basically, it is rooted in unequal gender norms in India and globally. there can be various types of GBP, which can be physical, sexual, emotional, psychological, harmful traditional practices, and social. It can take many forms, such as intimate partner violence, sexual violence, child marriage, female genital mutilation, and so-called honor crimes. The consequences and the results of GBP are devastating and can have lifelong repercussions for survivors. Anxiety and depression among 8 out of 10 domestic violence survivors, as per study of OSC. It can even threaten our life. There can be some very serious outcomes of GBP, which can be femicide, suicide, AIDS-related mortality, and maternal mortality. You see, COVID-19 pandemic, when it came, it really complicated the issue further, primarily because of number of issues. And there are various issues which led to a complication of GBP. When I talk about Mumbai, which has roughly 14 million people in Greater Mumbai and 20 million population, all of Mumbai, because of long lockdowns, we initially had 5 weeks of lockdown, and then we had repeated lockdowns, which led to economic stress. It led to limited access to go out of homes. It led to lack of social and formal support. It led to restricted movement, increased dependency. And in Mumbai, you have 87% people who live in 7% families who live in one-bedroom hall kitchen flats in multi-story buildings, and you have 97% of the population living in just 2 bedrooms. So just imagine with children, and we have a family, joint family system where you have parents, grandparents, children, grandchildren living together. And once they are all locked up in one-bedroom flats, you can imagine for, say, weeks together, what could be their mental stress levels, and which directly contributed to increase in gender violence cases. For example, globally, before COVID-19 pandemic, on average, 13% of women population were affected by GBP, which rose to 33% during the pandemic times. India also, it increased from 19% to almost 30.5%, and similar to the figure of a Maharashtra state. Globally speaking, you will be surprised that in many developed countries like Australia, New Zealand, in Australia it went from 3 to 23, almost 700% increase. Similarly, in a country like Scandinavian countries, it rose from 5% to 25%. Even in the United States of America, it went from North America, US, Canada put together, from 6%, it rose to 25%. So this is how this pandemic had a very devastating effect as far as GDP is concerned. And even Indonesia, the figures went from 19 to 20 to 31. From 9 to 21. So what does data trend indicate? So the various categories like spousal violence or physical violence during any pregnancy, and these are the percentages where women sought help to stop violence. We had launched helplines in Mumbai that if there's any domestic violence or any GVP cases, they should directly report to us. And we would get thousands of phone calls every month. And they went many-fold, and we had to issue orders in Mumbai that if any woman complains of, a married woman complains of GVP, the husband would be put in institutional quarantine compulsorily. And we were very strict, and we had a lot of institutional quarantine centers in Mumbai, and we did act on these cases, and we had made it very clear to the husbands that if there's any cases of of violence reported, the husbands will have to go to institutional quarantines. If you see the National Commission for Women in the year 2021, it shows that the domestic violence we had on more than 6,000 cases, harassment of married women for dowry and dowry deaths, 4,500 cases, molestations. Then state-wise, we had these figures. Now, GVP survivors reported in Mumbai, pre-COVID period, between April 18 and March 19, we had 2,399 cases, which went up to 3,677 between April 19 and March 20. And immediately during pandemic time, when the COVID hit Mumbai in March 2020, in that financial year, 2021, they almost doubled from 2,399 to 4,750. And the various types of GVP cases reported in Mumbai, 50% of them were domestic violence, 35% was intimate partner violence, and then sexual violence 2%, neighborhood conflict. So we had these various categories of reported, documented cases of GVP. And you see, even now, last year, 2021, these are comparison of last 3 years. You know, what the root cause of GVP is that men think that they have a right to control wives. And this is the root cause of, if it's a great mistake, then husband is justified in beating his wife. Why not a cow will not be obedient without beatings? So this is the root cause which we need to be addressed, and we are already addressing in a big way. Now, the factors which led to increase in gender GVP during COVID pandemic was economic stress. When jobs were lost, there were no job opportunities, there were repeated lockdowns for weeks together. So bread-earning member of the family was unemployed. It led to economic stress. And that stress translated into psychological issues and ultimately led to domestic violences and gender-based violence. Then, like I mentioned earlier, the limited freedom to go out, limited accessibility, disaster-related instability, then lack of social and formal support, restricted movement, increased dependency, staying with family member, conflict over child care, household responsibilities. Like in India, men are normally not used to doing household chores, but in lockdown, everybody had to chip in. And that also led to conflicts many times. The COVID-19 pandemic had significant gender impacts. Women and girls were at heightened risk of being exposed to the virus due to the job of frontline nature of work. You know, like just somebody mentioned that predominantly the medical, paramedical and healthcare workers were predominantly women. And they were like frontline workers in the fight against COVID also. On one side, they were hit by COVID while acting as frontline workers, and at the same time, they were also affected because of GVP at their homes. Even in these lockdowns, there was a sharp increase in intimate partner violence. Additional 15 million women and girls were exposed to GVP with every 3 months lockdown measures worldwide. And 78% of GVP-related operations reported that sale or exchange of sex as a coping mechanism occurring. This also became a very big issue in COVID pandemic. Data showed an increase in calls to helplines in many countries, including Mumbai and India, and sexual harassment and other forms of violence continue to occur on the streets, in public spaces, online. An increase in India, an increase in violence against women during global COVID-19 outbreak has been described by the United Nations as a shadow pandemic. It became a pandemic within a pandemic. And in 2020, we had maximum number of more than 7,700 complaints coming to us. And in India, as per the latest National Crime Records Bureau report, which were released in September 2020, an average of 87 rape cases were registered daily in India in 2019. And this was rising. You know, there are very myths and realities about GEP. GEP can happen only to poor and marginalized women, which is not true. The data from North America shows Australia, New Zealand, North America, Scandinavian countries, there was 400% increase in GEP, unlike the poorer countries where it doubled. So this myth is not true that only the poor people are affected by GEP. And GEP is not common in industrialist countries, even that has also been proved wrong. And normally the myth was that the gender-based violence is by strangers. But COVID has proved that the majority of cases of gender-based violence happen among the family members only. Now, response to what response we had to gender-based violence? We started NGO legal aid services, which were already in vogue, but we activated them further. There's specialist healthcare services. Then we went for a few shelters for domestic violence, media campaigns, programs from men aimed at promoting gender equality, and use of technology in a big way. Like we would had WhatsApp systems. Anybody suffering from GEV, we could always WhatsApp us, and we would immediately respond back and reach their homes and talk to them. And if the need be, we would take intervention exercises. We also initiated a lot of reforms and policy changes, which was going on from the earlier times, but we expedited them now. Specific legislation of family, domestic sexual violence, training of judges, because when many of the cases go to the courts, the judges need to be sensitized. The judges need to be more fair, and they should be able to appreciate the GEP cases. Then equally important is training of police personnel. Starting off, we started a lot of many women-only police stations to address these issues, and then legal aid services for victims. Similarly, reform of medico-legal system to improve forensic evidence which is collected and preserved. Now, best practices on GEP, integrating the services, then comprehensive care package on GEP. Then we have to implement models. We implemented Mumbai one-stop center or Dilasa centers where counseling takes place, and involvement of communities and health workers, and involvement of the entire health machinery in general to adopt as a best practice on GEP. In one-stop centers, we have health volunteers who can be approached, and in one single stop, various types of services like crisis intervention, temporary shelter services are provided to women and children 24/7, and the feedback system is made operational. So we have one-stop centers all over Mumbai to address the issue of GEP. Then we have women's OPD outpatient department in our all hospitals. We have 186 hospitals in Mumbai. Out of this 186 hospitals, we have 44 owned by MCGM, the BMC, and there we identify the survivors by through healthcare providers, and there is a crisis intervention by counselors. The women OPD and referral systems are there, and the feedback works further. This is how the community intervention takes place at the psychological level, at the counseling level, monitoring, identification, response, litigation services, stakeholder engagement, then group education services, women groups, then we have campaigns, then cases identification. So various initiatives are taken, and we have gone in a big way. We have vigilance committees in our residence areas, in the colonies, to address these issues. Now, what are lessons learned in pandemic, and what are the way forward? You know, we realized that during the pandemic, social stigma was there, the fear of being blamed, not believed or mistreated by police, lack of confidential areas in police stations for a woman coming to complain, and lack of victim support services. All these issues were highlighted. And we also have learned a lesson that we need to use technology in a big way, and we need to engage our security services and to address GVP anonymously also. To address the needs of shadow pandemic of COVID-19, which is GVP, the state and central governments, along with the BMC, implemented some of the most innovative support systems. The National Commission for Women launched a WhatsApp number to report domestic violence during the lockdown, and also started telecounseling and telemedicine facilities in the state. This was highly useful because we used to get dozens of phone calls every day, and we would visit them and address their issues, and it did create a fear in the mind of males that if this case is reported, then the police or the BMC officers are going to visit us, and they may be in a problem. Yeah. So then we also started the Red Dot initiative, which allowed women to express distress through a decorative dot on their forehead if they were unable to disclose verbally. And similarly, we started Akshara initiative, a web app to stand up for against violence. Where we started a number of only women police stations and women helpline numbers. The government decided to set up 300 one-stop centers in a phased manner after the pandemic. And this is a work in progress now. Then we also started Do Kadam, 2 steps towards equality through government helplines, crisis centers, and shelters of women. Domestic violence cases have risen during pandemic. This I already mentioned about Mumbai. We also have gone for monetary relief, compensation order, protection, and safe residences. We had various helpline numbers in Mumbai, and NGOs joined hands with us, and anybody could report on these helpline numbers for BMC to intervene in a big way. We also had a number of organizations in Mumbai, who non-profit organizations, who we joined hands with, and they have done a wonderful job in addressing the issue of GVP. Thank you very much.
Thank you very much. Dr. Ibal Singh Kalal. He is also widely given credit for his achievement in handling COVID-19's undercheck in Mumbai. And after we learn from the best practices and lesson from Mumbai on COVID response and recovery, and now it's time for us to go to Seoul. Just now, Mr. Nicholas Booth and also Ibu Widya Stuti always mention about Sunflower Seoul. So now we are going to have a contact to Seoul through online, because we do have our next speaker, the Senior Consultant UNDP Seoul Policy Center, former Associate Director Seoul Sunflower Center, Ms. Hee Young Park. Is she already joined us?
네, good morning, everybody. 제가 화면 공유를 먼저 하고 말씀드리겠습니다.
Ms. Park?
예, 잘 들리시나요?
Hello?
잘 안 들리세요?
안녕하세요.
네, 잠깐 화면 공유하고
We are from Jakarta, Indonesia, Ms. Park. We try to talk to you through online. We are here in Jakarta for the talk show for Urban 20, Indonesia 20 and 22.
네, 시작하겠습니다.
I don't think that she can hear us here. Let's just wait for a couple of minutes. Let me just read a little bit, a short bio about Ms. Hee Young Park. She is graduated from Ewha Women's University in 1985 with a BA in social work and MA in mental health social work. She served as an associate director of Seoul Sunflower Center between 2010 and 2020 and lead the one-stop service for the SGBV survivors. She is an expert in sexual and gender-based violence with over 30 years of experiences and expertise in child abuse, sexual violence against children, psychological health, psychiatric social work, and prevention of sexual violence. She has been teaching as a part-time lecturer at Sungkyuwon University and currently serving as a senior consultant at UNDP Seoul Policy Center, focusing on integrated service mechanism of SGBV, or sexual and gender-based violence. We are going to try again to have a connection to Seoul. And I would like to remind all of you, ladies and gentlemen, distinguished guests, if you need interpreter devices, you can have it in the register table. Kalau butuh interpreter, mesinnya bisa diambil di meja registrasi, disilakan untuk diambil supaya nanti kita bisa sama-sama mengikuti acara ini hingga akhir nanti. And gently reminder, if you have the interpreter devices, the channel number 1 is Bahasa Indonesia or Bahasa, and then English for channel number 2, Korean channel number 3, and Spanish for channel number 4. Are we connected already to Seoul? A very good day, Ms. Park. Can you hear us here in Jakarta?
Can I start here now?
Of course. You want to start now? I can see your beautiful smiles from here. We are here in Jakarta, Indonesia. We would like to hear from you because you are going to have the integration of services for addressing violence against women and children in Seoul. So the time is yours, Ms. Park.
예, 제가 한국말로 시작을 하겠습니다. 예, 저는 방금 소개받은.
Okay, let me present it in Korean. My name is Park Hae-young, and thank you for inviting me to this very important event. Due to the quite constraint of time.
예, 그래서 저는 오늘 특히 이제 서울.
Today I would like to focus on the capital of South Korea, how we support the victims using this integrated service. Due to the constraint of time, I'll briefly go through. This is a brief introduction of Seoul. It is the largest metropolitan city, and it is one of the 17 administrative districts in South Korea. Earlier, Jakarta has more than 10 million populations, whereas Seoul has just under 10 million. And also, it has the largest number of the victims, and also we have the largest number of support centers in South Korea. As you can see in the map, the red spot is where Seoul is located, and then you can see also where South Korea is located in the world map. Going through to the next slide, if you've been to Korea, I'm sure there are many, and also there are many who haven't been to Seoul as well. So these are some snapshots of Seoul. We always welcome you. The gender-based violence, if I share you a bit of data, the most common type is domestic violence and sexual violence and sex trafficking. Those are the most common GBVs. So from the Korean National Police Agency, we annually, looking at, as you can see on the right graph, we populate those data. So the most common is sexual violence, followed by domestic violence and dating violence. However, from the Korean National Police Agency's perspective, they have somewhat different data, and then they focused on surveillance and reporting. This year, the new government has started, and they focused on GBV policies are focusing on the victims of digital crime. One of them being guaranteeing the right to be forgotten for the digital sex crime victims, because they suffer so much from the content where they are exposed to get reproduced. Therefore, the government is focusing on that right. And another one is strengthening protection and support victims of 5 major crimes, such as power-based sexual violence. So this is one of the policies the current government is focusing on. And also, if you look at the how many centers we have in Seoul for those victims, we have 38 sunflower centers nationwide. Among those, 5 of them are located in Korea. And also, we also have a sexual violence relief center of 169 in Korea. And 16 are located in Seoul, and 4 of them focusing on people, the victims with disability. And I mentioned the digital sex crime is increasing earlier. There are 13 centers globally, nationwide. And one of them is national, and another one is local government, and another one is NGO. And also, we also have a sexual violence was highlighted in 2018 among the art and film industries. That's when we have the Act on Rights of Artists enacted. And it was surely become effective shortly after. It is supported by the Ministry of Culture, Sports and Tourism. And we also have a emergency relief center who helps those victims by using emergency relief call, 5 domestic violence relief center who provides counseling support. And also we have a 6 institution for sex traffickers. Among those violence relief centers, one of them specializes in victims who are men. These images show you some of the meetings held by the Working Together Support Network. This group works with the Sunflower Center who regularly meet to share the information and also keep each other updated regarding what is currently trending. So this is a very ongoing meeting which I would like to highlight. With regards to sexual violence, as I heard from some of the speakers in Jakarta, someone mentioned the importance of the integrated services. So I wouldn't necessarily mention how important the integrated service is. So I think I will be able to omit the majority of them. In Korea, the NGO service was first launched in 1991, and the Sunflower Center was opened in 2004. And then we also aim for one-stop support service. And in South Korea, digital crime cases are increasing dramatically. And I'm not sure whether you're aware of this Telegram nth room incident. This really made the entire population in South Korea boiling. After that incident, we had this support center and institution enhanced after that incident. I will explain in further later on why this, the importance of a one-stop service was, I think, sufficiently explained earlier by other speakers. Sunflower Center was established by Sexual Violence Prevention and Victims Protection Act. Currently, it is supported by the Ministry of Gender Equality and Family, university, hospitals, and local government, local police agency. And each operation cost is paid by the national government, 50% of it, and the other 50% is covered by local government. There are 5 sunflower centers in Seoul, which has 3 types. One is called integrated support type, which we have one of the center, and 3 of them is crisis intervention, and one of them being supporting only children. Sunflower Center provides one-stop integrated service. We provide counseling support, medical support, legal support, psychological support, accompanying service, and social support, all in one stop. This is a report from last year, how much support we have provided. This shows the data for nationwide, not Seoul alone. We support around 30,000 people, and the total number, as you can see, it's about 42,000. And the portion that Seoul takes is about 30%. And one more thing that I'd like to highlight, you can see in the blue box, is the satisfactory rating, which we use 5 points scale. As you can see, it's a 3.4 out of 5, which is very highly satisfactory. If you haven't been to the center, I'd like to show you some images of the center. You can see the waiting room in the first, in the left upper image. And also, if the victim insists on protection, this person will be taken to a different room to submit, her interview. And also, if we have any mobility of people, then we get support from the local police stations. So the lady you see in the bottom right image she's from also the local police, who is on-site police officer. This is where the victims take rest and get treated. And also we have a psychological counseling room as well. We have 24/7 the nurses and doctors who take evidence out of crime and also provide counseling. And as I said earlier, Seoul Center is an integrated service type which provides consistent and constant support. And we also have a psychological test room, and we have also space for children as well. Some of the supports are individually provided. However, we do have some group counseling and support sessions, including children and adults. And we have a lot of visits from overseas as well. The people you see in the images are, I think, the Japanese visitor, Dr. Tsubaki, who works for a Japanese NGO. In Japan, they don't have this type of center at a national level. Hence, she sort of expressed her, a desire to have one in Japan too. This was a, we signed on MOU with the Korean Archery Association in 2020. The Archery Association, the archery itself is very strong in South Korea. And the association who support the archery group, the association, also express strong desire and commitment in prevention and protecting the group in children and in women. So we had a meeting 2 weeks ago. The image you just see was taken 2 weeks ago. And I mentioned the digital sex crime a lot earlier. And during the pandemic, this type of a crime tended to increase a lot. Even though I'm not presenting any data, but the digital sex crime cases rapidly increased during the COVID-19 pandemic. As I mentioned, the nth Telegram incident earlier. So currently we have 3 centers who support those digital sex crime. One being Digital Sex Crime Victim Support Center, and the second one is the Seoul Digital Sex Crime Relief Support Center. Their main purpose is to delete those sexual images, because those victims usually come to you and say, I don't need any counseling. However, those who do insist on having counseling assistance, then we do provide them. Digital sex crime is usually illegally photographed, and then they produce and reproduce, and they also threaten you with those material. These are the most common types of crimes. So within the Ministry of Women's, what we think is most critical is to delete those film materials. By supporting this, for the first 3 months, we endeavor to delete those materials, and we constantly report, keep those victims up to date, and this deletion support continue for the next 3 years. And the second center, which we launched in Seoul this year, its functions are same as the previous center. However, the additional the function is to provide one individual counselor to those victims. So whenever those victims need some help or assistance when going to the police stations or counseling center, this person will accompany. The last one being the culture and art sectors, which we will enact and implement from next month. So I'm also part of this Korean Artist Welfare Foundation, and I will be planning to be supporting this foundation. And I will be training. I did provide 3-hour training on those victims, how this violence can be protected, in the future. This image is the snapshot of the homepage of the Korean Artist Welfare Foundation. These foundations will be legally enhanced, and its scales will become larger. This is also a homepage for the people in the film industry. There has been a lot of gender-based violence in the film industry as well. So we do provide support for those victims. As you can see on this homepage, you can see how much efforts they're making. And on the homepage, you can also see the dashboard where you can see the figures of how many consultations have been made and etc. And thank you for listening. This is all I prepare.
Thank you very much, Ms. Park. Please give an applause. Thank you very much. Oh, I thought that I'm going to see her again, and she's gone already. Thank you very much, Ms. Park. And I hope that we can have another insight from Seoul. And we do have... Oh, hello, Ms. Park. You're still with us, actually. Okay. Thank you very much, Hamsamida. Thank you very much. And I hope that we do have another initiative with Jakarta, Indonesia, especially. Thank you so much. Thank you for the insightful. Thank you. Goodbye, Ms. Park. Thank you so much.
감사합니다.
Thank you. So, ladies and gentlemen, after we hear and listen to all the enriching presentations that support a sustainable and safe city agenda during and after the post-pandemic, and surely we cannot wait to hear the expert reviews and also comments from the city delegation from the city of Quito. So without further ado, we will welcome the delegate from Quito City, a very beautiful city, one of the World Heritage, I guess the first World Heritage. Yeah, the first World Heritage, so it's a very beautiful city. Please welcome the City Councilor of Quito, Mr. Juan Manuel Cairon.
So thank you very much. I tried to do this half and half in Spanish and English. My language is Spanish. I try to do this in English. If it's necessary, I do some part of my short presentation in Spanish. But I think it doesn't matter the language, if it's Spanish or English or Korean or Japanese, because I think everybody in this salon, we share the same preoccupation about the matter of human dignity. I think that is about human dignity. The gender-based violence, with some difference, is a humanity problem. It's everywhere. And I am a politician. As a city councilor, I am in this position elected by the people. And we, the politicians, we must develop in our position. In my case, I am in charge of the legislation on the city as a city councilor, and also in the control of the administrative actions of the mayor. But mainly, I am in charge of the legislation with my colleagues. And the legislation must be supported by the information based on science, based on research, based on all the information you provide us. All your statistics mainly are the same in our country. If we see the numbers, maybe are very similar, and the intensity of the problem during the pandemic is the same circumstances. Very briefly, I can tell you in our politics are based in 4 lines of action. I think the first one is it's focused in health, is the attention and prevention. The first step when you have a victim of gender-based violence is provide the help they are needed, and the help is attention. That must be medical attention, psychological attention, socioeconomic attention, that people need a place, a safe place, and a refuge, a house. So first step is the attention. The second one is the restitution of the lost rights, because this is means the loss of the basic rights of human dignity. And when we lose these rights, they must be restituted. And because with this restitution, the victims found a way, a road for his life, for her lives. So they need help with the child, but I explain you very shortly later. So the second step is the restoration of the lost rights. By constitution in our country, the constitution says we are a nation, a country, multicultural, pluriethnic and multicultural. That means we must put attention on all the variety in our nation and all the so it's a constitution based on the guarantee of the rights. The third step is its help in develop new capacities, try to find alternatives for improve the economy, for help, for example, with capacitation and many different labors for give the independence of generate her own resources. And the fourth line is the monitoring and the segment of follow the development of the problem. So we have with these four lines is the spirit for develop 3 special initiatives in Quito, focused in 3 houses. One house is for women over 18 years. They can use that as refuge for 6 months, and they can go there with the kids. The second house is for, and they go voluntary. They can go voluntary there. The second one is a house for young girls under 18 years, most of them also with the kids, and they go there by a legal resolution. I mean, it's a judge who sent the victims there, and the income and the check-in and the check-out for putting in terms of hotel is provided by youth. And the third one is a house for the community, a house for share, because the problems of violence is not only of gender, many different types of violence. And as the governor of Jakarta mentioned in his intervention, there it's a place for everybody, not only residents in Quito. We have a big population in mobility in our country, and it's a big problem for that kind of population. We have also some campaigns like Zero ACOS, is no ACOS, on the public transportation. This is a big campaign. We are very close to inaugurate our first line on the metro in Quito. Quito is a city of 3 million inhabitants. This was the moment for that campaigns on places where you have a lot of people together, and we call Zero ACOS. It's no ACOS to the women there, and this is not just for law. It's because we are looking with these campaigns the involucration of all the society, all the community. Is the respect to the others is not a matter of legislation, it's a matter of human condition, is an individual revolution in some way. And the last thing I want to mention here, I think is pertinent to these reflections. It's about the equality and the proportionality in the public conformation of our institution. For example, we have a mayor and we have 2 vice mayor women. And for the elections, we are 21 councillors, and we try 1 man, 1 woman, 1 man, 1 woman. In our secretaries is also this, we are looking for this equality. And that, I think it's in general, what I hear today, after a long trip from my city, we are exactly in the antipodes. Quito is the antipode of Jakarta. If we make a hole here, crossing all the world, we arrive to Quito. We have exactly 12 hours of difference now. Maybe, yeah, a few minutes ago, it was Monday there. So it was a long trip, but I think, as you mentioned, it's the moment for the cities and for the city cooperation, and it's not barriers for this. So we are coming here for participating in this very interesting panel, and also our observators of all the Urban 20. And I hope Quito will be in the future more integrated in all these initiatives, focus in obtain better life conditions for everybody, and for save and preserve the human dignity. All we are human beings, doesn't matter if we are men or women, the dignity is part of the human condition. Those are my short reflection in this very, very nice country and very nice moment. Thank you very much.
Thank you very much. Thank you so much. That's a very beautiful insight, that everybody, us not talking about women or men, we are all speaking in the same language. It's about humanity, right? And now we are facing the same problem as in medical, is in health, and then social and physical. And by then, we have to hand in hand each other so we can collaborate and cooperate more among cities, and hope that we actually can move on from this COVID-19 and make the best for the world. That's a very beautiful insight. Thank you very much, Mr. Huan. So, ladies and gentlemen, if we're talking also about move forward, move on, we're talking also about innovation. So before I'm gonna bring all of you to, well, let's say to try an innovation and technology, I would like to open a session of questions and answer, so Q&A sections. Due to a very limited time, so I'm going to have 2 questions first. Okay, 1, 2, 3. Wow, that's a lot. That's a lot. Okay, 2 first. Oh, okay. So who's going to be the first? Okay, I think that's a lot. Bu Dini mau bantu? Oke. Okay. Siapa yang udah tunjuk tangan duluan nih Bu Dini? Aku, oh oke deh, silahkan bantu aku. Oke. Silahkan langsung dikasih mikrofonnya. Boleh tolong sebutkan nama dan kemudian berasal dari mana dan pertanyaan ditujukan kepada siapa.
Okay, thank you very much.
Thank you.
Okay, I will try to speak in English. Okay.
Please do so, please.
My name is Mary. I'm from Sahid University, Posapa, from Posapa. I would like to give an answer to Mr. from India.
Mr. Iqbal.
Yes, Mr. Iqbal. Great to see you, Mr. Iqbal. Okay, just like Mr. Spanish say that...
Mr. Juan.
Mr.
Juan.
Okay,
yeah.
sorry.
And he's from Quito City.
Okay.
That's in Ecuador,
Beautiful,
actually.
beautiful
Yes,
city.
he's speaking Spanish, correct?
Okay, we all are here agree that we have to decrease the violence against women and children because of humanity. And I heard from the source, from the news, that in India, it was happen, a violence against women and children, a Muslim. The question is, why it could be happen? That we are all human in here. We have to stand up for our humanity, whatever their religion is. And the second question, what will do for the government in India to stop, to overcome the violence against women and children, Muslim in India? Thank you very much, Mr. Iqbal.
Thank you very much. Okay, Mr. Iqbal, because she's talking about social media.
What was the first question?
Okay, the question is about that. She actually watch and hear from social media about the violence of women and children in India, and especially for Muslim. So probably you can actually, how to say that, whether it is true or not, because it's true social media.
Well, I must tell you that whatever you see on social media is not correct at all, because many times social media is driven by various different agendas. For example, in Mumbai, we have a population of 20 million, and out of 20 million, almost 3 million are Muslims. But there is no such discrimination at all in Mumbai. You can come and see that as far as gender-based violence is concerned, or violence against children is concerned, there is absolutely big zero as far as discrimination on the basis of religion is concerned. India is a secular country, and our secular credentials are very strong. And some incidents do happen in remote corners of the country where literacy is not very high, where people are illiterate, but in places like Mumbai, this could be treated almost as zero.
Okay, so regarding it is correct or it is not correct of what happens in India, Mr. Iqbal.
Social media does report such issues, but I would request that my experience is that we have to discount social media, especially regarding religious issues, almost 70 to 80% they have to be discounted. What the report?
Oke, jadi sudah di-encounter ya Bu, sosial medianya belum tentu benar, tapi data-data yang ada adalah di sana justru beragam, 30%-nya hampir umat Muslim, jadi sangat dilindungi. Jadi nanti tolong dicek kembali tentang social media tersebut, kira-kira begitu kalimat.
And plus, India is a very mixed society. Like I am a Sikh turbaned. I'm like my family members wear a turban. We are from Punjab, Sikhism. So my relatives are Muslims also. We have some relatives married in Muslims, some in Hindus, some in Christians. So we are very open society. India is a very vibrant democracy. And I always say that India is one of the most vibrant democracy that you can say anything against anybody and you can get away. So India is the biggest democracy in the entire world with the 1.3 billion people. And the kind of right to freedom we have in India, we are really proud of that.
Okay, so go to the next question, Mr. Iqbal, the second questions, regardless whether there is wrong, regardless about that, but actually how do India itself stop the violence in children and women, especially the question is about the Muslim just now.
Yeah, as far as, like I mentioned in my presentation, that we have taken a number of steps over the years to ensure that violence against children and violence against women has to minimize. The single biggest issue to minimize violence against women is to make women financially independent. With financial independence, a lot of issues get automatically, they evaporate. So there is tremendous amount of focus in India, especially in bigger cities in particular, to push women employment. Like you'll be happy that, like say in our municipal corporation in Mumbai, which is the apex body for the entire city, and the Mumbai's municipal commissioner is like equivalent of a mayor of some European city, and where unified control is there for all the facilities. So we have now public transport buses run by women drivers. We have four-wheel taxis in the cities, large number run by women. The ratio of employment of women in almost government and other sectors is very high. In public representations, we have 50% reservation for women. In employment, we have 33% reservation women, and this is happening for the last number of years. And because of this, the percentage of women in employment sector is increasing manifold. And this is the best way to, if you make your daughter or your wife financially independent, the issue of gender-based violence can disappear to a large extent. And we are really focusing on this. Besides this, like I mentioned in my presentation, that we need to sensitize our police department, for which we have started women-only police stations, so that women feel free and comfortable visiting them. Then we have to sensitize our judiciary, judges, that once such cases come to them, they can be very fair and impartial, and they should be sensitized what the gravity of gender-based violence is. Similarly, we in our all hospitals in Mumbai, we have separate sections for they are like OPDs to address women counseling and to address cases of gender-based violence. We have one-stop centers which are started up. We have large number of NGOs in operation. Like in Mumbai, we have dozens and dozens of NGOs who are working with us, and they themselves also help us in addressing the issue of gender-based violence. But I have very firm view that as women's financial independence increases, and the day like you have majority of women in employment sector and they are financially independent, to large extent this issue will come down. Thank you.
Okay. Okay, Bu Mary. Are you happy with the answer? Okay, I can see your smile, so I think it's a release for the answer, right? Okay, silakan Pak.
Terima kasih. Saya Febi Datubangso, staf khusus Wali Kota Pariaman. Hari ini hadir bersama Kepala Dinas Pemberdayaan Perempuan dan Anak Kota Pariaman. Jogjanya Pak Wali Kota ada di sini, tapi kebetulan bersamaan Pak Mahfud MD juga lagi di Pariaman meresmikan Mall Pelayanan Publik. Kami dari Kota Pariaman mengapresiasi apa yang telah dilakukan UNDP bersama Pemprov DKI, karena kita melihat bahwasanya Rumah Sakit Tarakan ini telah menjadi model, dan Bu Kadinkes izin kami dari Pariaman akan studi banding ke Rumah Sakit Tarakan, khususnya Bunga Tanjung. Yang kedua, kira mungkin Pak Wali Kota Pariaman, khususnya kami masyarakat Pariaman itu fokus untuk mengaplikasi apa yang telah dilakukan oleh Rumah Sakit Tarakan. Tapi tentunya tidak mudah juga, di samping model ruangan, tapi adalah kemampuan dokter di daerah ini kan tidak sama seperti Jakarta. Kami mungkin punya dokter SPOG, tapi kami tidak punya dokter forensik di situ. Apakah UNDP memberikan pelatihan atau peningkatan kapasiti untuk rumah sakit umum daerah ini agar program baik ini bisa kami aplikasi di Pariaman? Itu satu. Kemudian saya juga tadi mengutip apa yang disampaikan Pak Gubernur, Bu Kadinkes, ini menarik sekali ya. Artinya program DKI dengan kota yang sebesar ini konsentrasi di program nomor 13 tadi. Tentang pemberdayaan perempuan dan anak, juga masalah kekerasan perempuan dan anak ini menjadi concern kepala daerah. Yang ingin saya tanyakan kepada Pak Sesmen, kan tidak semua kepala daerah ini yang fokus atau punya feel mau melaksanakan program ini. Kira-kira dari Kementerian Pemberdayaan Perempuan dan Perlindungan Anak apa aja yang di-endorse? Karena kan kita melihat kalau kasus ini kan makin lama makin meningkat. Di daerah, karena masih banyak merasa malu, ini tidak terungkap. Kami saja yang kota kecil kalau di googling, Pariaman itu termasuk yang tingkat kekerasan perempuan dan anaknya tinggi. Itu yang terungkap. Yang tidak terungkap mungkin masih banyak lagi. Dan saya ingin juga tanya kepada last speaker yang dari Ekuador, beliau ini kan juga politisi. Artinya kebijakan legalisasi ini kan ditentukan juga oleh parlemen atau politik. Bagaimana Ekuador mengungkap kasus-kasus yang tersembunyi? Kita ini banyak sekali hidden case. Karena rasa malu, rasa ini semua itu ditutup-tutup. Padahal ini juga sebenarnya tidak sehat. Dan tentu saja kita apresiasi juga Undang-Undang 12 2022. Tapi sayang ini Pak Sesmen, undang-undang yang diperjuangkan sangat luar biasa. Tidak hanya oleh para aktivis tapi juga termasuk perempuan yang ada di parlemen. Tapi ini kan kayak tidak ada sosialisasi. Padahal kalau kita mau baca secara utuh, undang-undang ini kan sangat luar biasa. Orang juga tidak tahu kalau hal-hal kecil juga bisa menjadi pidana. Yang mungkin bisa saja Kementerian PPA dengan UNDP menggandeng ya community ataupun perguruan tinggi untuk mensosialisasikan Undang-Undang 12 ini. Jadi percuma aja undang-undangnya diperjuangkan sebegitu dahsyat, tapi ternyata sosialisasinya antara ada dan tiada. Saya mendengar kemarin salah seorang ya narasumber di salah satu organisasi Jakarta Selatan bercerita tentang kekerasan perempuan, nggak tahu kemana mau ngadunya. Ini fakta loh. Ini mungkin hal-hal yang menurut saya adalah perlu juga mendapat perhatian khusus dari Kementerian Pemberdayaan Perempuan dan Perlindungan Anak. Baik. Dan tentu izin nanti Bu Kadinkes, kami banyak belajar karena kami ingin mewujudkan itu ya. Mungkin kalau ada Bunga Tanjung mungkin saja di Pariaman nanti Bunga Seroja lah kira-kira begitu.
Baik.
Mungkin itu saja. Terima kasih.
Terima kasih banyak Pak.
Terima kasih atas undangannya untuk kami yang ada di sini. Bu Peri, ini sekalian Ibu Kadis ini.
Baik, terima kasih
Menambahin
banyak.
dikit ya.
Oke, sedikit ya Bu, sedikit saja karena kami waktunya sangat terbatas. Mungkin bisa dipersingkat.
Ya, terima kasih Bu. Saya menambahkan dari Pak Datuk Febi ke Bapak Mr. Nicholas. Ini Kota Pariaman, kota kecil dengan luas wilayah 73,4 km dengan jumlah penduduknya kecil 95.000. Nah, tapi dengan kota kecil ini angka kekerasan disebut tinggi tadi. Tetapi kami kalau di DKI tadi menyampaikan untuk layanan kesehatan ya di beberapa rumah sakit, tetapi Kota Pariaman punya layanan gratis kesehatan seluruh warganya dengan universal health coverage-nya 99,6%. Jadi seluruh warga kota sudah dijamin kesehatannya. Nah, yang pengen kami tanyakan di sini adalah kerjasama dengan UNDP untuk dalam hal pencegahan. Kita fokus pada pelayanan kasus. Tetapi pencegahan ini sangat penting sekali. Edukasi sangat diperlukan. Kami berharap bisa terjalin kerjasama Kota Pariaman dengan UNDP dalam hal memberikan edukasi kepada masyarakat kami. Seperti yang sampaikan Pak Datuk tadi, ini yang terlaporkan baru sedikit. Cukup besar yang tidak terlaporkan, apalagi dengan mungkin rasa malu dan lain sebagainya, ini tidak dilaporkan. Ini salah satu edukasi upaya adalah untuk bisa perempuan dan anak ini bersuara. Mungkin itu yang kami harapkan untuk Kota Pariaman. Terima kasih, Assalamualaikum warahmatullahi wabarakatuh.
Terima kasih banyak. Oke, ini saya bisa melihat semangat dari Kota Pariaman yang berarti juga mewakili banyak kota-kota lainnya mungkin di Indonesia yang sebetulnya punya semangat yang sama ketika kita berbicara mengenai kekerasan pada anak-anak dan perempuan. Jadi kita berikan tepuk tangan untuk semangat ini. Karena ini hebat sekali. Salam untuk Pak Wali Kota pastinya nanti supaya bisa hadir juga di sini dan memberikan suaranya juga untuk perempuan dan anak-anak. Yang pasti ini ada beberapa pertanyaan ya Pak Datuk ya. Okay, first of all I'm gonna ask berarti ke Pak Nicholas, betul? To Mr. Nicholas first because they are keeping saying of having joint initiative with UNDP because they feel that they actually have the what is it called, the urge about violence in children and women in Kota Pariaman or Pariaman City. But they feel that they don't have the capability of human resources to actually enhance that. So what do you think about this in Pariaman City and how can UNDP also give advice as well? Thank you. Do you want the microphone? I'd like the microphone, yes please. Right. Tunggu sebentar Bu. Oh ini punya Ibu, oke. Okay.
Thanks, Kina. So I really like these questions. So the whole point, I talked about, the innovation and the inspiration of cities, right? And the whole point of the work that we've been doing in Jakarta, and in particularly the Tarakan in the hospital and the Bunga Tanjung, is to provide a model. And the point of a model is to inspire, and it is to be replicated. And so for me, nothing is more exciting than to hear about other cities, smaller cities elsewhere in Indonesia that want to do the same thing. Though actually, so you're sitting right next to the real expert, Pak Shamsul, who runs our program. And I want to pay tribute to their work. And I know that our objective is to help this model and these centers to be replicated all over Indonesia. Like you say, the conditions will be different. The capacities, resources of different levels are going to be different. So how we do it, like we need to work closely with the health authorities, but we designed a model to be replicated, and what we need is your enthusiasm and your willingness, and we have that. So that's great, and with your help, we will move forward on that. And I also wanted to comment, if I can go straight also to the question from your colleague, and you talk about the underreporting. Right? The fact that there are far more incidents of violence than we know about. And you say we need education, and we do need education. But we kind of need more than that. You know, we need to think about the huge barriers that face women from, you know, when they try to come forward. You know, there's so much stigma, right? There is so much kind of shame that is kind of created by the community and by social norms. It's incredibly difficult for survivors to come forward. So, you know, it isn't even just about education. We've got to change behaviors and change norms. That's one of the hardest things to do. We focused on providing services for women, one-stop services for survivors. And we have to have the laws in place and the services in place. But now we need to go to the next step. And the next step is to change behaviors, to take down the barriers which actually come around from prejudice, from stereotypes, that are actually the things that stop women accessing services and justice. And actually, again, Pak Syamsul is doing that right now. We are working with behavioral scientists in Jakarta with these services to try and understand what are the real barriers, talking to women, what are the real barriers that they face, and how can we use science to change behaviors. So it's education, but it's more than education. And when we begin to learn those answers, we need to spread that all around Indonesia too. So thank you very much for your great questions.
Thank you very much. So we're going to wait for Kota Pariaman to get bunga seroja, right?
But not wait too long. Talk to Pak Syamsul right now. He's right next to you. Get the program going.
Oh, they already handshake. Oke, mungkin boleh berdiri untuk handshake. Nanti kita lihat lagi ya bagaimana kelanjutannya dari sini ya. Sekarang masih duduk handshake-nya. Nanti after that, then we're going standing and then do a very good and massive handshake. Thank you very much for that. Okay, so ini menarik because asking about flowers, if we do have bunga Tanjung di Jakarta, tadi dari kepala dinas ke kepala dinas lainnya, mungkin bisa dikomentari sedikit Bu, because they're asking the same flower as well. If we do have flower Tanjung, mohon maaf Pak, mohon izin, terima kasih. Mungkin boleh dikomentari sedikit Bu, karena ini tadi Ibu Kepala Dinas juga yang kemudian berkomentar, karena kalau di sini kita punya bunga Tanjung, kita boleh dong juga punya bunga seroja di Kota Pariaman, langsung begitu Bu. Jadi ada banyak bunga nanti yang tumbuh kembang sangat cantik untuk perempuan dan anak-anak Indonesia di seluruh Indonesia, harapannya gitu.
Ya, terima kasih Pak Datuk dan Bu Kepala Dinas yang telah antusias. Kami siap menjadi tempat untuk menjadi kaji banding. Kebetulan saya didampingin oleh Direktur RSUD Tarakan, mungkin Bu Dian bisa berdiri. Jadi nanti bisa langsung bertukar.
Langsung Bu mau salaman juga? Ibu mau salaman juga langsung? Oke.
Tentu memang kearifan lokal menjadi penting. Jadi pada saat kami bersama UNDP ke Sunflower, melihat bagaimana layanan komprehensif di sana secara paripurna, ternyata belum tentu harus sama plek dengan yang di Sunflower. Kami melihat bagaimana Jakarta dan itu atas inisiasi dari tim Tarakan mengadop tetapi memodifikasi. Kemudian yang kedua terkait dengan sumber daya, sekarang dengan era digital saya kira itu tidak menjadi sekat. Kita pun siap kalau tidak sempat hadir bisa melalui Zoom atau apa yang kita siap untuk lakukan. Terima kasih.
Thank you very much. Aduh, Ibu senyumnya bahagia sekali sepertinya hari ini ya. Nanti akan ada bunga seroja merekah cantiknya nanti pasti di Kota Pariaman. Okay, so as you said Mr. Juan, it's about collaboration and cooperation among cities. And that's what happened today. They're actually really trying to make a step of collaboration, talking about DKI Jakarta, talking about Kota Pariaman. But the questions from Mr. Febri from Pariaman City is about the policy itself. Tadi Ibu yang tanya ya, sorry, Ibu atau Bapak ya tadi yang tanya, Bapak ya. The policy itself, how is the policy in Quito City that can emphasize to reduce the violence of women and children?
Okay, thank you. I think in many ways, on legislation, for example, the femicide is is a very strong treatment. I mean, in comparison with another kind of homicides, the femicide, it's a very serious thing. So that is, I think it's part of a prevention thing. Understanding the reality of the communities in the city, very different to the rural areas, because in the city all all these cases of violence the neighbors are looking for that, and if the victim maybe is not responding directly, it's somebody around them who take the action, and that helps. Some symbolic moments, for example, I think are symbolic actions, but we approve a resolution for give the name of the streets and public spaces of Quito 50-50. I mean, at least 50% of the street must have names of women or the public spaces. I think this helps to develop the pride of the identity, and this is good. And another action is don't forget the aggressors. We have put the focus on the victims, but the aggressor is also a human being with special needs, and I think the prevention starts in educational programs. In Spanish, we have, in our culture, when we were kids, is famous here, this phrase in Spanish, los niños no lloran. That means the boys don't cry. And that develop a special attitude we must change. When I talk about the change, is looking for the femininity in the males and vice versa. We are complementary beings, and in the way with education we start changing this. So the reality for tomorrow must change. And in the cooperation in the cities, I think all these initiatives in this kind of moments, and in that moment when we share this experience, that helps a lot, because we return to our countries with the richness of all the information, new information in a trip. That's my answer.
Okay, thank you very much, Mr. Juan. Ada a very strong commitment, itu kata yang bisa saya dapatkan dari Pak Juan. Makanya saya akan ke Pak Pribudiarta, Pak Ses, karena ini berkaitan dengan komitmen yang kuat. Tadi sudah diapresiasi oleh Pak Febri, mengatakan bahwa sudah ada undang-undangnya, sangat diapresiasi, tapi komunikasinya ya Pak Febri ya. Karena masih banyak yang ternyata belum tahu Pak Ses tentang undang-undang ini, dan bahkan kemana saja tidak tahu. Saya ini harus kemana, padahal saya korban dan menyaksikan betul adanya kejadian ini. Silakan Pak. Mohon izin, can I have the microphone please? Thank you very much. Izin ya Pak, terima kasih.
Ya, terima kasih Pak Stafsus Kota Pariaman. Terima kasih Pak. Jadi ini pertanyaan menarik sebenarnya, karena bagaimana pertanyaannya adalah bagaimana peran nasional ya, terkait dengan mulai dari pencegahan sampai penanganan. Jadi saya boleh sebutkan di sini Pak ya, dari undang-undang tadi seperti Bapak sampaikan, Undang-Undang 12 tahun 2022 sebenarnya menyebutkan ada 10 kementerian yang harus bertanggung jawab gitu kan. Jadi kalau ditanya apakah Kementerian PPPA yang bertanggung jawab, sebenarnya ada 10 Pak. Clear di situ disebutkan dalam undang-undang. Pertama itu Kementerian Bidang Kesehatan, Kementerian Bidang Sosial, Kementerian Bidang Hukum, Kementerian Bidang Luar Negeri, Kementerian Bidang Dalam Negeri, Kementerian Pendidikan, Kementerian Agama, Polisi, LPSK, dan BP2MI. Jadi itu ada 10 kementerian yang harus bertanggung jawab terhadap pelaksanaan ini. Karena itu dia bukan semata-mata menjadi hanya tugas satu kementerian. Karena kita sadari satu kementerian tidak mungkin bisa menangani masalah yang memang terjadi sangat kompleks ini. Nah, terus kemudian yang kedua terkait dengan masalah sosialisasi. Memang kembali lagi bahwa undang-undang ini sebenarnya menyebutkan bahwa pemerintah pusat dan pemerintah daerah sama-sama bertanggung jawab Pak untuk melakukan sosialisasi. Jadi ini tanggung jawab semua pihak sebenarnya. Bahkan di situ disebutkan ini juga tanggung jawab masyarakat sebenarnya. Jadi tanggung jawab dari masyarakat apabila mereka melihat terjadinya kekerasan, mereka wajib untuk melapor. Masyarakat kemudian melakukan pencegahan, upaya pencegahan di tingkat komunitas. Itu juga menjadi tugas sebenarnya. Jelas itu clear disebutkan di dalam undang-undang. Cuman sekarang kan bagaimana kita melaksanakan itu tadi. Nah kemudian yang kedua sebenarnya terkait dengan masalah pendanaan, terkait dengan masalah SDM dan lain-lain. Kementerian Keuangan sebenarnya bekerja sama juga dengan Bappenas dan Kementerian PPPA itu telah memberikan DAK Pak. Jadi sudah ada anggaran DAK yang diberikan kepada hampir 216 34 provinsi dan 216 kabupaten kota. Kenapa hanya 216? Karena memang ada persyaratan di dalam pemberian DAK. Pemberian DAK itu mensyaratkan yang pertama memang harus ada laporan rutin ke dalam simponi. Jadi kami sudah beberapa kali disampaikan juga oleh Bapak Presiden bahwa ada laporan pendataan tingkat nasional yang namanya simponi. Datanya adalah data sesaat. Sistem informasi perempuan dan anak. Itu dia didukung oleh 4.000 lebih provider. Baik itu lembaga pemerintah maupun lembaga swasta. Baik itu polisi misalnya atau LSM. Nah, ada 4.000 lebih yang melaporkan itu secara berkala, secara rutin. Nah, simponi ini kemudian dia menjadi pusat pendataan untuk data kekerasan terhadap perempuan dan anak yang sifatnya sewaktu. Jadi bisa dilihat setiap waktu. Seperti tadi saya sampaikan di awal, ada disparitas yang lebar memang antara data yang hasil survei oleh Bappenas, BPS maupun hasil dari pendataan itu tadi. Bapak dari Kota Pariaman nanti bisa akses langsung Pak, melihat langsung dia berkala datanya seperti apa perkembangannya, meningkat atau menurun, Bapak bisa lihat dari situ. Dan itu juga bisa menjadi bahan untuk Pemda dalam rangka mengambil keputusan. Kalau dia naik berarti harus ada keputusan yang baru Bapak keluarkan kan berarti, terkait dengan masalah kebijakan sampai dengan masalah pendanaan. Nah ini terkait dengan bantuan dari pusat untuk pendanaan di tingkat daerah melalui anggaran DAK. Nah, memang ada beberapa persyaratan yang harus dipenuhi oleh pemerintah daerah, terutama itu tadi. Pertama laporannya, kedua terkait dengan masalah adanya lembaga yang menangani, Pak. Jadi harus ada lembaga yang menanganinya itu tadi di tingkat pemerintah daerah. Apakah itu dia berupa dinas, masih berupa dinas, atau dia sudah berupa UPTD. Nah tentunya skornya itu nanti yang paling besar kalau dia sudah berbentuk unit layanan UPTD itu tadi. Nah demikian juga ada beberapa hal lain, misalnya kondisi APBD daerah itu juga akan mempengaruhi. Jadi kalau yang fiskalnya tinggi tentunya itu tidak menjadi bahan pertimbangan, tapi yang fiskal rendah biasanya menjadi bahan pertimbangan besar. Itu saya kira yang beberapa hal yang bisa kami laporkan. Ya tadi terkait dengan beberapa pertanyaan. Saya kira itu ya pertanyaan.
Ya, intinya sudah dijawab Pak. Terima kasih banyak. Dan ini adalah akhir dari sesi tanya jawab karena waktunya juga sangat singkat. Jadi saya minta tepuk tangan yang paling meriah. Please give a round of applause for Mr. Nicholas Booth, Mr. Pribudiarta, kemudian Dr. Iqbal Singkelal, Ibu Widya Stuti, and also Mr. Juan Manuel Carrion, dan juga yang bergabung bersama kita from Seoul, Ms. Hee Young Park. But this is not the end, because talking about move on and talking about innovation and technology, so this is a time for us to experiencing the virtual reality demonstration. What is it and how is it about? This is going to be very interesting. And also we invite all of you to try it on. So, akan ada petugas yang datang ke Bapak Ibu semuanya untuk bisa mencoba seperti apa. This is a VR, this is the next future. And we will also gonna play the VR on the big screen. So all of you can experience the breakthrough innovation in service provision for GBV prevention. A joint initiative between UNDP and DKI Jakarta. Let's have a try. Be careful because this is a bit difficult. You want to take out your glasses? You want to put your glasses or you want to take out? How is it? Can't you do it? Pak, bisa dibantu, Mas? Okay. Is it okay? Is it too tight? Mr. Nicholas Bird? Is everything okay? Pak Ses aman, Pak Ses? Kasih jempol kalau sudah aman. Kasih jempol kalau sudah aman. Aman? Oke. Oh dia mau lihat saya, oke. Oh Pak Febri udah coba duluan dia Pak. Oke. Is all good? Let me check. Mr. Nicholas Booth, are you okay with that? Are you good? Okay. Mr. Pak Ses? Okay Pak, aman? Mr. Iqbal Singh, aman? Okay, good. Are you okay, good? Mr. Juan, are you okay, good? Good. I think they're all already experienced a lot of things, so they are moving around by themselves. Okay. Ibu Widya Stuti, are you okay? Good already? Here you go. Let's experiencing. This is the new future of the VR. The breakthrough innovation in service provision of GBV prevention, a joint initiative between UNDP and DKI Jakarta Government. And all of you can see in the big screen. Just wait for a while. 3, 2, 1. Here we go. This is a 360 degree of the joint initiative between UNDP and DKI Jakarta Government. This is a very, very nice experiences. Look at that. Mr. Juan is turning around in the right side, turning around here. Datu, aman Datu? Aman. Okay. What do you see over there, Datu? Apa yang dilihat, Datu? Aman. Okay. Are you good with that? What do you see, Mr. Juan? Could you share with us?
Yes.
Okay. See? It's a very, very interesting experiences. As you can see in the big screen, that's how we're going to see the joint initiative in the next future with the VR. You can see, are you good? Mr. Juan, are you good? Okay, wow, okay. It's very interesting. Pak Febri aman kok diam aja Pak? Oh aman, oke, oh menikmati, oke. Saya pikir Bapak kok diam aja, are you okay? Pak Ses aman, Pak Ses sudah ngeliat apa aja Pak Ses? Kok kayaknya seru Pak Ses kiri kanan gitu. Ibu Widya Stuti aman? Kok kayaknya diam aja Bu, aman? Oh good, okay. Mr. Iqbal, what do you see over there? Do you want to share with us?
There's a bed there, there's a corridor, there's a kitchen. I can see everything.
Oh, he said that he can see everything, including the kitchen katanya. Okay. Mr. Nicholas Booth, let me ask you, what do you see now?
Oh, actually, I stopped seeing anything. I saw a nice circle right here, but it just disappeared.
Oh, he said that there is a disappeared picture. Is it this me? Okay.
There was a nice circle right there, but it just disappeared.
You can try it out. All right. Are you good? Okay. Gimana Bapak Ibu yang sudah merasakan pengalamannya? Di belakang sana, coba saya ke belakang sana ya. Coba saya ke belakang, kira-kira gimana? Bu, dipakainya yang benar atuh Bu? Sebentar. Pakai aja. Ibu Kepala Dinas Kesehatan coba Bu, apa yang dilihat Bu? Bu, saya mau ke sana Bu. Coba, apa yang dilihat? Apa Bu? Bioskop. Yang dilihat bioskop. Ibu pengen nonton ya? Habis nonton Pengabdi Setan ini pasti dia ngomongnya bioskop. Oke. Bu, apa yang dilihat?
Baru dimulai. Masih langit, baru dimulai soalnya.
Oh, masih langit baru dimulai.
Ini baru mulai masuk lagi. Ini sih masih di bagian luar ya. Masih di ini belum jalan gambarnya.
Oke, kita tunggu ya. Kita tunggu nanti kita tanya lagi pengalamannya. Oke, Pak Ses sudah aman? Sudah bahagia Pak Ses? Mari muter-muter tadi Pak Ses. Oh, cerita dikit lagi Pak Ses, cerita dikit lagi.
Ya, saya sudah lihat 360 derajat bagaimana kondisi dari pusat layanan terpadu pemberdayaan perempuan dan anak, terutama terkait dengan penanganan.
Oke, aman ya Pak Ses? Oke. Ini Pak Huan kayaknya menikmati banget ya. Oke, bagaimana pengalamannya? Seru ya? Seru? Oke. I can see all the smile over there. Do you want to share your experience?
Yeah, very nice experience.
A very nice experience. What did you see just now?
What I see? Well, all the facilities, all the rooms, and 360 degrees, and up there, down there is.
All right. Thank you very much. Thank you very much. Terima kasih banyak untuk semua speaker dan panelis hari ini. Berikan tepuk tangan sekali lagi Bapak Ibu hadirin sekalian. Thank you once again for all of you, ladies and gentlemen, who are already participating in the virtual reality demonstration. Hopefully, you found it to be fascinating experiences to you as much as I do as well. And after this, we're going to have a closing remark from the Mr. Christian Asfinit. And for that, we would like to invite the head of RRU, Mr. Christian Asfinit, to deliver a closing remark. Oh, okay. Okay, just a photo session, and before that, we're going to have a closing remark from Mr. Christian. Okay. Oke, ada lagi yang mau diajak? Silakan. Sudah semua? Please give your best smile for today. Satu, saya hitung ya. 2, 3. Thank you. Smile, smile, smile. The best smile. Oh, stop violence. Okay. And hopefully all the initiative can be replicated not only in DKI Jakarta but also in all the provinces in Indonesia. Thank you very much. Thank you so much for all the speakers and all the panelists. And next, we are welcome the head of RRU, Mr. Christian Asfinit, to give the closing remark for today. Oke. Ini saya izin pinjem ya, Pak Christiannya mau memberikan closing remark. Oke, silakan Pak. Ladies and gentlemen, this is the closing remark from Mr. Christian Asfinit, the head of RRU. Can we have your attention, please? Because we still have a closing remark for today.
Perhaps everyone is too excited.
Yeah, too excited because of the virtual demonstration just now, Pak Christian. Yeah.
So, may I start?
Yes, please.
Okay.
Thank you.
Excellencies, distinguished speakers and delegates. It's actually an honor for me to meet and learn from the inspiring speakers, the panelists, the city leaders from other countries that come from all of the backgrounds and expertise. My greatest appreciation to them for their excellence and insightful perspective. My deepest gratitude also goes to all who attended our discussion here with us or virtually and helped to make it success. Thank you very much for taking the time this morning prior to the Urban 20 Summit to dig deeper and draw lessons learned and tackling what we call the shadow pandemic of all violence against women and girls. And of course, I would also like to thank all of my colleagues from UNDP, provincial government of DKI Jakarta, and other supporting staff who have worked hard, tirelessly, and professionally to make this session possible. I believe during our morning talk show of service innovation in GBP prevention and response as part of inclusive social recovery in DKI Jakarta, I have witnessed our collective commitments to heading towards post-pandemic cities which mutually empower local communities through youth, women, girls, and vulnerable groups. The disproportionate impact of COVID-19 pandemic to women and vulnerable groups indeed demands coordinated, decisive, and innovative policy action from the leaders, policymakers, and all stakeholders. We must recognize that the most vulnerable, especially women, have been hit the hardest, and we all must do better to protect and prevent any harmful violence of this pervasive human rights violence against them. Excellencies, ladies and gentlemen, I have learned from our peers that countries and cities have promoted innovation as well as policies and programs in place. This shows our remarkable progress, especially putting women at the center of the development agenda. Women must be engaged to ensure their meaningful participation, to listen to their voices. There is nothing more real and profound than hearing from women. In this case, women survivors, whose stories inspire all of us to stand up for justice and human rights and to do more to prevent, address, and end violence against women and girls. Building innovation also means to work together across sectors. Partnership between governments and officials such as the police, non-government organizations are key, as well as working closely with other stakeholders such as the judiciary, academia, media, and traditional religious and community leaders. We also know that ensuring safe and accessible services for women, especially for the gender-based violence victims, is essential during and post-pandemic. Policies and measurements that are sensitive and protective to women need to be established, as well as adequate resources must be devoted. Lastly, the best way to end violence against women is by preventing it from happening in the first place. Awareness raising becomes critical, not only to educate women, but also men in this issue. Awareness raising should touch upon the root causes of gender-based criminalization to promote sustainable solution. Government and leaders must lead by example, and UNDP will continue to support to building back better and safer from the COVID-19 pandemic through inclusive, resilience, and sustainable recovery strategies. It is our commitment to work hand in hand to the advancement of the implementation of 2030 Sustainable Development Agenda that seeks to strengthen universal peace and to leave no one behind. With that, I encourage an urgent call to our greatest and collective action to build sustainable and safe cities so that every human being can live of fear, free of want, in freedom and dignity. Thank you all again. Stay healthy and stay safe.
Thank you very much. That was a beautiful closing remark from Mr. Christian Asfinit. Thank you so much. And that's the end of the series of high-level talk show events. Road to Urban 20 Summit has officially ended. So thank you very much for all of you who has been here and through the journey of us from the morning until today. Good afternoon and see you again in the next event. Saya ingatkan kepada Bapak Ibu semuanya untuk absensi, karena absensi ada di registrasi, dan juga mengembalikan interpreter device yang tadi sudah diambil di meja registrasi. Terima kasih banyak, kami ingatkan sekali lagi untuk mengembalikan interpreter device and also absent di meja registrasi. Terima kasih banyak.